All right, good morning everybody who's joining us. We're still waiting for folks to get all signed in. We don't want to start the party without all the guests. So welcome and thanks for logging in and being so timely. We appreciate it. And we're excited. Today is an exciting day. We've got a jam-packed several sessions, and we hope that you stay through to the end, especially for our Millen-Z panel with Mackenzie Grow and Grace Song and Jasmine Guevara. So we're super excited about that team and hearing their voices. That will round out the end of our day. And this morning we will be starting with the presentation of the Lark Award for Dr. Ferrer. She couldn't join us this morning, but she has sent a video and we will be playing that in just a few moments after we present her award. So thank you all for joining us as we celebrate her continued heroism at this time during the pandemic. We're also very excited about our Slate for Justice. So those of you who were with us yesterday may have heard us talking a little bit about that. And as you can see yesterday, many of you may have not had an opportunity to meet an important participant in our activities, but coffee is my plant, and it actually is a coffee plant. And Coffee insisted on participating in the Slate for Justice as well. So you will see she is donning her Slate for Justice pin. I don't have a color printer or else it would be more colorful, but I think this shall suffice for today. I would encourage you all to make use of your printing devices. You too can wear a Slate for Justice pin. All it took was my printer and a pair of scissors and we were good to go. So I'm excited about that. Today is also Native Women's Equal Pay Day. So I am in celebration of that and my very small percentage of DNA that 23andMe has told me about of Native American roots. I am donning my Navajo earrings and necklace in honor of Native Women's Equal Pay Day. So excited about that. I'm also excited that there's been announcements that Assembly Bill 3121 calling for reparations in the state of California to people of color, in particular African Americans, is a part of the discourse. And so in many ways, I think we have much to celebrate despite the insanity that is constantly in our news feeds and our social media platforms. We are here today to talk about advancing strategies and solutions for resilience. And we're going to hear from many, many, many powerful and, just fantastic women and women of color who are leading the charge on multiple fronts to affect change in every corner of our lives, whether we're mothers, whether we're scholars, whether we're teachers or, caregivers. Every role that we play is significant and important. And so today, as we get started, and I think I'm going to go ahead and get us going. It's 10:07. So again, thank you for all you early birds. Appreciate having you with us this morning. The first person we're going to hear from will be our esteemed and fearless leader, Veronica Flores. She is our Chief Executive Officer of Community Health Councils and our Social Change Institute. Which for those of you who don't know, Social Change Institute is Community Health Council social enterprise. And under that banner, we do quite a bit of work as contractors and funders, working in partnership with many of our local foundations. And today we are honored to present our Lark Gilliam Galloway Award to this year's recipient, Dr. Ferrer. And with that, I will turn it over to Veronica.
Thank you, Michelle, and good morning, everyone. And again, welcome to day 2 of this summit. I am super honored and humbled to introduce a friend and colleague who truly represents the strength of our mothers, sisters, cousins, and sister friends, and how we show up to speak truth to power. Well, in today's world, this is no small feat. right? We're starting to share information about truth and it gets hit by denial or shame. And so today we are recognizing a woman that by standing with information, by standing with truth, that could save all of our lives and providing basic public health information to help us manage the impact of this horrible pandemic and what it's meant to our communities is in fact threatened by others who don't want to hear information or truth, or it's felt like someone is controlling their lives. So we live in a world right now that public health is thought of as the enemy. So we want to make sure that when we represent ourselves, that we have someone like Barbara, Dr. Ferrer, in front of us, because she has shown the power that we are all carrying at this time. And it's exhausting. So without further to say, let me introduce Dr. Ferrer as the recipient of the Lark Social Justice Achievement Award for her commitment and leadership in addressing equity and public health during this COVID-19 crisis. Barbara Ferrer is the director of LA County Department of Public Health. She's nationally known public health leader with over 30 years of professional experience as a philanthropic strategist, public health director, educational leader, researcher, and community advocate. Having worked at several large government entities and foundations, she has proven track record of working collaboratively and equitably to improve populations' outcomes through efforts that build health and education equity. The Lark Social Justice Achievement Award was established to honor CHC's founding director, executive director, Lark Galloway Gilliams, because of her passion and commitment to social justice. And I personally carry, along with my team, her legacy. And it's important for us to be building upon those shoulders of someone like Lark. Dr. Ferrer represents that. The purpose of the award is to recognize and commemorate an individual, group, or organization that passionately promotes social justice and equity and achieves equity in environmental and community resources to improve the health and well-being of under-resourced populations. Thank you, Dr. Ferrer. And now we'll hear her words.
Thank you so much to Community Health Councils for blessing me with this extraordinary honor of being presented with the Lark Award, named after your late founding executive director, Lark Galloway Gilliam. After founding CHC in 1992, following the LA riots, Lark and her team were visionary in addressing the driving factors influencing health outcomes. Lark led efforts to expand health coverage, improve the health care safety net in communities with the fewest resources, increase access to healthy and affordable foods, and improve the environment. Her mission to eliminate inequities and to partner with others to build equitable systems serves as an inspiration to me and probably to all of you. I'm deeply honored to be presented with this award in her memory. I want to start by taking a moment to appreciate Community Health Councils for all that you do throughout our community, especially during these difficult times. Your presence in our communities is more important now than ever, as we have seen the exacerbation of health, social, racial, and economic inequities in our community during this pandemic. When COVID-19 hit, CHC did what it has always done and took action. For example, in South LA and Compton, where about 32% of households are food insecure and about 13% of households are very food insecure, CHC formed a partnership with First 5 LA and Sustainable Economic Enterprises of LA to distribute over 17,000 food boxes to residents. These collaborations are all so necessary to address the immediate needs of communities and become even more important when working towards changing entire systems. And that is where your CEO, Veronica Flores, has provided brilliant leadership. We saw her leadership on display at Public Health in the effort to ban the sale of flavored tobacco. CHC engaged and organized with community members and organizations through their Health Kids Zone Partners and Ambassadors program about the harmful effects of flavored tobacco products on children and teens. By organizing and working together, the ban on flavored tobacco was passed late last year. Thank you, Veronica, for your unwavering determination on so many important issues and for working toward a more just society. CHC has always been critical in promoting the health of our communities, especially those facing the greatest inequities, and we are blessed to have you as a partner. And lastly, because there's nothing I have ever accomplished by myself, I owe a debt of gratitude for the many people who cared for me, patiently taught me, helped me get back on track when I misstepped, and were my eyes and ears when I didn't see the way forward. A million thanks to my wonderful family, amazing friends, brilliant DPH colleagues, and great county and community partners. I know this day is day one of your summit, so I want to take a moment to say how grateful I am to everyone in attendance. And thank you so much for your collective work building a secure, equitable future for women, particularly for women of color. While I know that this may be a little bit different compared to what previous summits look like, collaboration with colleagues and partners is often the seed of ideas and action. I know this year's summit will be the productive and invigorating experience for all. I think it's fitting to remind ourselves of all of the talent and dedication among our colleagues. I know that I have often benefited from the wise counsel of the many women who have been creating and sustaining transformational change, which really comes when all of us are able to work together. And it starts by organizing and taking direction from those most affected by the issues and those who understand the opportunity. I am grateful for the leadership of Brenda Aguilera, who serves as the Director of Community Transformation at Para los Niños, which works to build strong communities through strategic partnerships with organizations across our county in order to connect children and their families to wraparound support, whether it's through one of their 6 learning sites or through their counseling programs. Brenda has been instrumental in building out capacity for organizations to collaborate with parents, residents, or other organizations, faith-based organizations, and businesses. It's this kind of collaboration that allows us to tackle the big issues, especially those that disproportionately hurt women of color, issues like infant and maternal mortality. Currently, Black women in the United States are more likely to die in childbirth than any other group of women. And Black women in LA County are 4 times more likely to die as a result of pregnancy complications than women of all other races. And they comprise 21% of those who die, even though they comprise only 5% of the childbirth cohort. Additionally, Black babies in LA County are 2 to 3 times more likely to die before their first birthday than babies of other races. This is a devastating tragedy that has gone on unchecked for decades. And it's taking all of us to work together to dismantle systems of oppression and racism that have sown a path of death and destruction in so many of our communities. Here in LA, we are connected to the Los Angeles County African American Infant and Maternal Mortality Initiative, which is a coalition of community members, mental and healthcare providers, funders, community organizations, First 5 LA, and county agencies, all working together to address the unacceptable high rates of Black infant and maternal deaths here in our county. I want to pay tribute to California State Senator Holly Mitchell, who has shown brilliant leadership on reducing these gaps here in LA County. She has done amazing work in Sacramento on behalf of this issue, introducing legislation such as the Dignity in Pregnancy and Childbirth Act, which will work to address and eliminate these inequities. And over the last 7 months, we've also seen our county's most vulnerable children experience disruption of educational opportunities because of COVID-19. These same children, primarily our Black and brown children and those living in low-income communities, already faced an epidemic of educational inequality. School closures and distance learning exacerbated those gaps. We all know there's no replacement for students being in the classroom. But there is more that can be done to make distance learning as effective and equitable as possible until we can get everyone safely back on campus. Women leaders like Dr. Deborah Eduardo are reminding us all the time that it is best to be of service and be part of finding solutions to fundamental crises. Under her leadership, the LA County Office of Education developed a response that engages community leaders, partners with other agencies to address gaps, and through their Greater LA Education Foundation, increased access to food, basic needs, technology, and academic support for distance learning. Each of these efforts to address pressing issues of inequality is part of a continuous push to organize with others and recognize the need to dismantle racism. And we have seen the dividends of organizing paid this year as we responded to this dreadful virus. Like so many of you, we are working with others to do everything we can to slow the spread of a new and deadly virus that has ravaged our most vulnerable communities, our essential workers, our residents, our staff, and residents at nursing homes, Black, brown, and Pacific Islander families, and those who live in neighborhoods that for years have seen disinvestments in infrastructure and services. And although, thanks to a lot of hard work led by so many of you here in the county, we have seen a drastic reduction in new cases, hospitalizations, and deaths since the peak during the summer, the gaps in health outcomes by race and ethnicity and community poverty levels, while starting to close in some areas, continues. This requires us to do a lot more if we intend to make sure that COVID-19 doesn't end up on the same list of so many other health outcomes that have people of color experiencing higher rates of illness and death than all others. On average, Native Hawaiians, Blacks, and Latinx people are 2 to 4 times more likely to test positive, be hospitalized, and unfortunately die when compared to white residents in LA County. And people living in communities with high poverty rates are more than 4 times more likely to die from COVID-19 than people who live in communities with little poverty. Women of color are even more vulnerable, as they are often essential workers in high-risk occupational settings, particularly as healthcare workers and first responders. The vast majority of healthcare workers who tested positive for COVID-19, 68% are women. Almost half are Latinas and Latinx, 15% are Asian, 11% are white, and 7% are Black. While this in part indicates the composition of the healthcare workforce, it also remains an example of how women of color are disproportionately impacted by this virus. These healthcare workers are truly among the heroes of the pandemic. They have been at the front lines, courageously battling and treating patients from all across our county from the very beginning of the pandemic, even when there was so little that we knew about this virus. And I know LA County deeply appreciates their commitment, and together we mourn every healthcare worker who has passed away from COVID-19. These heartbreaking disproportionalities don't need to continue. We have made progress, and we do have a chance to close these gaps for good. But it will take our collective efforts to do so in a manner that tackles the root causes of disproportionality. And once again, I'm honored to receive the Lark Award, and I am blessed to stand beside you as we work to dismantle deep-rooted systems of racism and oppression. Thank you so much.
Right. Well, that was powerful, very powerful, and we appreciate, I know everyone, and I see all the comments on the chat, deeply appreciate the incredible work and contributions of Dr. Ferrer, and even more so in lifting up and continuing to recognize Lark's legacy that continues to live on through community health councils and the work that is championed every day in the field. For our next session, which I'm really excited about, The Price of Motherhood in South LA, is a study in partnership with LA Care Health Plan, who supported funding for this study, around how, the lack of economic access and economic harm, how that impacts mothers, particularly in South LA. What we've learned over the last few years is there's a lot of aggregated data around how systemic racism impacts communities of color, in the housing areas, in the wage gap. But again, the data is aggregated, so it's not very place-based. And so what we wanted to do was really look at South LA in particular and get a firsthand information from about 100 Black and brown women living in South LA on how, their month-to-month and daily living and their access or inaccess to resources impacts them. Today and yesterday, we heard folks talk about Lark's legacy, and when the LA uprisings happened in 1992 and the formation of community health councils and the critical focus on health, on food, on the built environment. I think that in the last few years, what community health councils has started to add on to under the leadership of Veronica Flores is now an additional focus on that lens of economic resiliency and economic access and economic development within the community. And that is what this first panel is really going to be focusing on, is talking at a deeper level about those challenges and how they are specifically impacting our mothers. And you'll hear a lot about the hope for the future, which is clearly something that was a struggle prior to COVID and the current economic downturn, and is continually exacerbated every day, as you heard from Dr. Ferrer, as we are all working collectively to mitigate the immense harms that are coming down the pike, disproportionately impacting families and communities of color at this time. So with that, I'm really excited. We're going to have several just amazing and dynamic speakers this morning. We're going to start this panel with Veronica Flores, who's going to speak to us a little bit more about, again, how we got here and the trajectory for this particular study. We'll also hear from Rebecca Ratzkin, who's our Director of Research at Community Health Councils and our Social Change Institute, and what her lens is being in this space and in our communities as a researcher, not only with us, but also with special services for groups in the past and many other organizations in her time as a researcher. And then we will then hear from our lead researchers on this, Melany de la Cruz Viesca, I want to make sure I always say that, Stevens, who are both affiliated with UCLA and worked actively to help us create the survey tool and instruments, and we will be working with them to issue the final report. What you will see today are our preliminary findings as we move into some more case study work around this issue of the price of motherhood in South LA. And so with that, I'm going to turn it over to Veronica Flores to get us started.
All right, thank you. So I'm going to share my screen right now, and all right. Hold on one second, please. So when we, as Michelle stated, just making some movements here. All righty. So when we started this, the idea of how we come to a place of understanding wealth in our communities. We talk about building wealth, but we first have to understand what is it that actually strips wealth from our communities? Because there are different elements that I think have to be known about the state of Black and Brown women when we talk about the economic aspects of our lives. And I'm going to say us because I am in this same spot. So when we think about this, part of the basis of our information has to contextualize our life experiences. One of the things that I really like that Rebecca always says is, we're issue agnostic. And because we have to look at the multiplicity of issues that actually makes up our lives. We don't live in a single issue. We don't live in an issue that says we're only in need of food, but we don't talk about housing or poverty or education or healthcare, children. There's a lot of that is an everyday experience. And then you layer all of that with the stress of just living in an institutional racist society. So I wanted to take a moment at the beginning of this to just really go through just some highlights that when we think about research, when we think about how we begin to evaluate our communities, particularly again around economic values, we have to understand the basis of this. So the first part I would say is, and I'm sure you all have seen this, but it's really about understanding that this is about institutional racism. So we're not talking about individuals, we're talking about the institutions and the practices and the policies that are already in place and have been in place since the beginning of the founding of this country, of this nation. And so this is not something that just started 50 years ago, 200 years ago. Our people go back 500 years ago. This has been in existence since US was launched. And this enterprise, as I call the US, was launched. So how do we look at this? We have to understand that there's a foundation to that. And there are impacts that come out of this. And one of the things that Dr. Ferrer mentioned a few minutes ago, all of the systemic issues have real implications for our lives. And these are just two. Black women are 2 times more to 6 times more likely to die from complications of pregnancy than white women, depending on where they live. Latinx women contract cervical cancer at twice the rate of white women. So these are just, again, there are a lot of issues about why we end up here. But then we have to talk about one of the aspects of our existence. Since the 1800s, the first discussion came into being about scientific racism. 1800s, and this is still part of our lexicon. This is still part of our research methodologies that are still looking at scientific racism. When we heard the debate this past week, and the president was asked to condemn white supremacists, white terrorists, he couldn't, he wouldn't. There's an entire movement that we've seen. And therefore, when we look at all of the racial uprisings that are happening right now, scientific racism basically tells us that people of color don't have the same abilities as white people, that we are less of a race because we are not white. So indigenous, Black, Native, all of us sort of fall into this one category. And so when we think about this, and we have to understand what that foundation has meant to our literature, to our education, to our medical system, that if scientifically someone can say we are different in a way that just only shows our deficiencies, that is something we have to be aware of. When we read data, when we read the reports, when we hear the news, understand that this has been around since the 1800s. Another area, and I'm just going to go very straight up, sort of breaking it out because I just want to make sure and bring it up. Another area that we're going to spend a lot more time at CHC in the next year as one of our research development pieces here, because it really impacts the way we think about our society. And I'm going to talk about resilience. So when we hear about resilience, right, resilience is defined as the psychological capacity to adapt to stressful circumstances and to bounce back from adverse events. The problem with this is that there's an expectation, just put on your big boy, big girl hat, and just, swallow it and move on. And so all of that is part of our lives. If we were in bed crying every time we experience those horrible impacts of direct racism that many of us have experienced on a daily basis and sometimes, where we heard yesterday from residents that are participants in some of our programs, and Miss Lydia spoke, and I just, and she talks about the killings of her family members, of her neighbors. Killings for no reason at all. Black young men. And this woman stood there yesterday talking about her commitment to community, her hope for community, her involvement for the last 30 years in trying to change her community. Well, we look at that and we say, she's got great resilience. What a great thing. And that thick skin that we begin to build as we build resiliency, there's also a negative impact of that. Because we have to look at resilience. Once it crosses that umbrella that keeps us safe, because we're building our power by building our resiliency, it becomes a moment. When in that moment, too much resiliency can make us feel like we just have to take it. So we become overly tolerant of adversity. And that is that line that we put the burden on communities of color, particularly impoverished communities of color. We put that burden as like, just keep hoping. Just keep hoping, because it's going to get better. Just trust the government, trust. And where is that taking us? So I think understanding resiliency and how we discuss that, because it's a research topic, it is an actual term that means something. And in mental health, this is one of the key elements that we need to begin to really understand the impact of over-resilience in communities of color, particularly women of color. Lastly, when we look at mothers, Black and brown mothers, and what is the economic future of Black and brown mothers? Well, we have to think that right now, as we continue to talk about, not having that parity, that income parity. Today, the income gap for all women is 79 cents to the dollar that men make. Now, if you compare that, when we start to add that Native Hawaiian and Pacific Islander women only make 65 cents to the dollar. African-American women, 64 cents. American Indian and Alaskan Native women, 59 cents. And Latinx women are at the end of the bottom of the barrel, 54 cents. We can go into a lot of details about why, but this is data that we need to understand. This is what we're dealing with. And most importantly, is that Black women are more likely to participate in the workforce than moms of any other race. And about 85%, and I want you to listen to that big old number, 85% of Black mothers are the primary sole or co-breadwinner for their families. That data is not about resilience. That data is about why these women are alone doing this. These women are making 64 cents to the dollar, and being the breadwinner of their family. When there's lack of education, when there's lack of support, when there's lack of housing, and all of these elements are around you, and you're trying to be a good mother. The other component of this, when we talk about resiliency, when we talk about mental health, all of it comes together. You know, data now shows that institutional racism has an impact on our DNA. That in fact, our DNA actually changes for the constant stress that someone lives every single day, right? It's constant. That at some point begins to change who you are. And people say, why are you so angry? It's like, why am I angry? At some point, that anger is either going to destroy you, or you're going to say, I need to do something with this. Hence, a lot of us on the line today, working in the nonprofit sector, being activists, we find other ways to support our communities. But we have to remember the other stressor of this is that when mothers have to have conversations with their children, when Black mothers must talk to their sons, their Black sons, about how you need to be when you walk out your door. But then Breonna Taylor. And what is that? It doesn't matter if you walk out your door. They can step into your own house in the middle of the night while you're sleeping and kill you. And I don't mean to be dramatic over this. This is exactly the experiences of women of color every day. When Latinx mothers have to talk to their children because they might be undocumented. I know my parents talked to me about that when we first came to this country. Don't meet with other children. Don't gather in the corners. Make sure you only speak English. You know, no, you don't need to be speaking Spanish. And we weren't allowed to even watch TV or read anything in Spanish for a year because we needed to learn English so that we wouldn't be targets. So there is a lot to what we need to think about when we think about the mental health of women of color. And then, and I'm not going to read this, I mean, you'll get all of these, but, you know, one interesting study that 2017 actually, that looked at the causes and effects of women's wealth gap. And, you know, when you think about words that come up for me, like we know all this stuff already, right? Wealth inequality, that women have lower levels of financial knowledge than men. Why? It's not that we can't do it. It's not that we don't understand it, it's that we don't have access to it. We have not had that access. You know, that we are denied, that we are unlikely to benefit from anything that comes forward when it comes to economic benefits, that we are dealing with a broken system, that millions of women of color are trapped in a cycle of debt, that is absolutely lacking our ability to build wealth. And when I say wealth, I'm not talking about wealthy the way we think of wealthy. I am talking about living out of poverty. So how do we build this tapestry of solutions? And so today we wanted to bring everything that happens this afternoon for the rest of the day is really about solutions. And so we have to talk about pay equity. We have to talk about access. We have to talk about how we support women of color building their credit scores so that they are able to participate in these economic opportunities. How do we decrease barriers for women of color? How do we expand opportunities? Because bottom line is, if we don't own property, if we have no say in how in a space where we are considered owners, nobody cares, not even our public officials. How do we expand the capacity of women's wealth? How do we increase women's access to retirement savings? How do we make tax subsidies for women more accessible? And then lastly, is regulate what we're going to talk about today, which are the wealth stripping products and services. So we must target solutions based on an understanding of where we are, because ultimately women of color, and this is completely by evidence and certainly not just my opinion, but women of color, we know by evidence that if women of color can thrive in an economic environment, the rest of society benefits tenfold. And we'll go into data later, but this is all based on evidence. So I want to move now to introduce, well, as Michelle will take over from here, but move on to our panel. And I think this is a great opportunity. We would love, again, as usual, lots of questions. This is just the beginning of this conversation. Thank you.
Wonderful. Thank you, Veronica. And that was a powerful presentation. You know, certainly speaking from the heart. I think it's always difficult for me when I'm listening, because I have raised, you know, 2 Black sons, and that has been a, you know, huge trial. And I know there are a lot of other mothers on the line who share the sentiment of what a difficult time it is for us just to see our partners or our children, you know, walk out of the door has always been a stressful time. But yes, especially after hearing the President of the United States tell the Proud Boys to stand back and stand by, it's even more difficult to watch your family members walk out of the door and have the assurance that you're going to see them come back through that door again. So thank you for that presentation. And with that, I'd like to spend some time hearing from Rebecca, our Director of Research. She has been a critical part in helping us really form, you know, our thoughts around this study as we went into it. And later on, when you have an opportunity to see the slides and hear from Melany and Pamela, I think that you'll see that we really tried to have an approach that was not just inclusive of some of the things you usually hear about, right? You know, like, are you on food? You know, are you getting EBT? And, you know, do you have problems paying your rent? And it's like, yeah, we know that, right? We all know that. These are the struggles that, you know, many of us have experienced, you know, with our families. My mom was a single mom. You know, I know all the things that she went through, you know, homelessness off and on. You know, there were a lot of things that happened. But really what we wanted to get at as well was, and how has that impacted your ability, you know, back to this idea of resilience, right? And what does that really mean? You know, and so one of the key questions we asked the mothers was about their hope for the future. And so I'm not going to, you know, give a spoiler because I want to save that for the presentation, but I want you to know those are the kinds of questions we asked. We asked them, you know, what sort of, you know, compromises, do they make compromises just to make ends meet, you know, to feed their families, right? Or to pay their rent, or whatever the case may be. So we really wanted to ask some of the harder questions that we don't typically hear, so that we could humanize this and not just make it like, here's another statistic about women of color in South LA, but really, you know, here's information about what these mothers are going through on a day-to-day basis. That's what we want people to walk away with today. So with that, I wanna go ahead and turn that over to Rebecca to share with us, you know, what her experience was in participating in this community-based research.
Thanks, Michelle. Yeah, so I'm going to share also a few slides, and then if I can just ask Mackenzie to help monitor the participant list of people coming in and out. But basically where I come from, you can all see me on my video. I am a white cisgender Jewish woman. And so that's the context I come from. And we really want to point this out and talk about it because it's important when we get into research design and we talk about all the things we're talking about. Community-based participatory research, what the data means, what the questions are, what the questions should be. And so I just want to share really briefly some things that I've been reflecting on with the, you know, support and collegiality of my with the great leadership of CHC and the colleagues and Melany and Pam and other folks that we're working with. Some folks who are on the call today or the webinar today, I won't name you yet. So I'm just going to share this couple of thoughts that I've had. And the first thing is just when we look at the research field, what are we talking about? And I want to go back to actually scientific racism. It's intentional. This is the research field, and this is a painting by a white man, Robert Ryman, for those of you who may have followed modern American Western art, who really made a career of painting white paintings. Various shades of white on white, all similar to this. And as I was thinking about this, and we've been talking about it internally, is that this is really how our data and knowledge is distributed and created and manipulated. And it's really through the lens of white men, but white people. And even when I, as a white person, and I am also speaking, to everybody here, and particularly the white people on our webinar today, that, we need to stop taking that for granted, or stop overlooking that and making assumptions about ourselves in this space. Because, we've been in it for a while and working through and thinking that the way that we're going about doing our research is the way to do it. So, which brings up my second point, which is about white fragility. One of the things that I really love about CHC and its leadership is about this element of being disruptors in all the spaces that we go into. And so for myself, and even in thinking about how I was raised and how I came to research, and what I love about research and data is that, I was taught and we're shown and create these statistics that, sure, there's some give and take, there's some perspective, we know there's an art to statistics, talking about margins of error, talking about sample size, talking about interpretation. And I've always been very frank and tell people we need to be upfront about the limitations of our data, but that there's truth here, truth with a capital T, or insight with a capital I. But my reality of having that be a constant and secure place is not the reality of people of color, where data has been used in extractive, racist ways to uphold white privilege and to uphold white power, and through, again, this control and the dictation of knowledge. So, but as research and evaluation is about reflecting and learning and adapting and insight and strategizing. So shouldn't it be a natural that we're more open, that we should have more flexibility, but it's not. We have to actually actively work to be disruptive. And so that's really what I'm about doing, not just for myself, but hopefully also, through seeds of planting those through all the work that we do and that I can be involved in, is to disrupt these patterns of white fragility that really are at a bedrock really often of a lot of the research that that takes place. Next slide is, so what does that mean? That means really not just, as Sonia actually spoke about yesterday, about shifting. She spoke a lot about the need to shift, right? Because this work is difficult, but it's not just that we need to shift and be flexible, right? That we're also working in an environment that's constantly shifting. But for me, as a cisgender white woman, I need to deeply listen. I need to have open ears and, again, not just assume because I'm a quote unquote researcher that I'm good at that, or good at that all the time, right? And so taking that moment to be open, to step back, and to create space, and that, I found myself just reflecting and saying, when am I really listening and when am I just waiting to speak, right? Those are two very different things. And so even though, I have been accustomed to, and we're in this space, we really need to learn how to, and I am working on how to learn how to open up and have deep listening to others, instead of asking them to just listen to me and what I say. And that's what this work is about. And a lot about what this work is about too, I've been ruminating a lot around biases, right, and blind spots. Because one of the concepts and frameworks of white fragility is that, oh, well, I have friends of color, or I've experienced, bias in my life. And also as a woman, sure, I've experienced sexism. As a Jew, I've certainly experienced bias. But again, I've got lots of blinders on, and I've been running around or driving around like a big fat semi-truck without the right rear view mirrors to be looking for those blind spots. So I've been looking at and how to install different mirrors on different parts, and how to think really intentionally before I'm speaking, knowing that, you know, sometimes I'm gonna move into a lane without looking, right? And hopefully gather people around me who will help me to see those and point those out. And again, part of that is in the design and in the questioning and in the interrogation of the work that we're doing. And so I'm so excited to be talking about the work today and the questions that we asked, and really getting into strategy, which leads me to the last point around this work that we're doing, and particularly just calling back what Michelle was saying and what Veronica was saying earlier, is that we need to start to ask new questions. We need to start to get beyond the obvious and question even the types of questions we're asking and the methods in which we ask them and the overall approach, and say, what is racist about what we're doing? Because we've just been doing it all the time. And so, you know, we have to question the validity of our tools and practices. You know, certainly I still use them, we still use them, but we really try to adjust them, to change them, to interrogate them, to pick them apart, and to see, okay, what's working for us in this place and what's not working, and disregard the aspects of the questions that don't work. As Michelle said, you know, some of the things we know, and some of them, let's face it, we need to have further research for context. But where are we really focusing our attention, and how are we opening up, you know, and how are we opening up also to how we look at the data? I've recently been having conversations with folks where, you know, maybe looking at the biggest pieces of the pie is not the way to go about interrogating and confirming, but it's to actually look at the whole pie and say, who's at the low end, who's in the middle, who's at the top, and look at the totality of that, and saying, if we're looking for equity, shouldn't everybody have an equal piece of whatever pie that we're looking to distribute? So I'm questioning all of these things. I'm listening and I'm looking for blind spots, being open to others' criticism, and really questioning the nature of how we use these tools to make sure that we're asking the right questions and doing it in the right way, so that we can really learn, so that we can gain new insight to create strategies that actually really address these systemic problems across different issue areas. And this work, this Price of Motherhood study, represents a step along that path. The work is designed and led by excellent and skilled researchers, women of color, and aims to reframe the questions and conversations about women, wealth, and equity, and particularly for Black and Brown moms. And I'm just honored to be part of the conversation and open up the space. So thank you. That's
Awesome. Thank you so much, Rebecca. We deeply appreciate your candor and your willingness to be in the space with us and to listen and to learn. And we're, you know, again, excited to move into really hearing more about the study itself. So without further ado, I'd like to introduce Melany, who is just a phenomenal scholar and actually has published numerous pieces of work around wealth inequities and communities of color. So with that, I will turn it over to Melany.
All right. Well, thank you to the Community Health Councils and Social Change Institute for the opportunity to collaborate on and be part of this important and much needed discussion on women, wealth, and equity. Good morning. As Michelle mentioned, I'm with the UCLA Asian American Studies Center, one of the 4 ethnic studies research centers at UCLA established in 1969. I'm also with the Closing the Women's Wealth Gap National Network, where I serve as the chair of the research working group. First, a big thanks to Michelle, Veronica, and Rebecca for beautifully setting the stage for me. I can't stress enough how critical and significant it is to be collecting data on Black and Brown mothers in South LA. Oftentimes we have data for women at the national level, so having data on women of color at the local level speaks volumes. Several years ago, I was part of a research team that analyzed data from the National Asset Scorecard for Communities of Color. It was funded by the Ford Foundation and produced this report, The Color of Wealth in LA. It was the first, and I believe the only time wealth data has been collected at the local level and disaggregated by certain race and ethnic groups for LA. demonstrating the importance of local asset markets. As we've seen in recent years, the gap between the rich and the poor has increased immensely, with the richest 10% of Americans taking home 48% of all domestic income. And this is why capitalism needs to be reformed, and why we need a new vision for the economy, and one that ensures all individuals flourish in the future. When we look at wealth, we're looking at it as defined as the total value of a person's assets minus their debts. And wealth is a better indicator of holistic financial security because it shows the extent to which an individual, family, or household can handle an emergency, like a job loss or illness, for planning for the future. And it plays a key role in upward mobility for individuals across generations. Income, on the other hand, is more of a measure of your compensation for paid work. So most studies, they primarily use income as a measure of economic well-being, but it really fails to capture the debt or wealth stripping factors and any kind of inherited assets that lead to wealth building. From our study, you'll see that the first graph shows the median net wealth that we found in LA, and then the graph on the right shows the median family income. And so very different, when you look at wealth versus income. And this is why we really need to start examining more issues around wealth status. The Color Wealth Report revealed an astounding racial wealth gap, where, in LA, Japanese who are like 4th, 5th generation have the highest median net wealth, followed by Asian Indians, Chinese, and whites. And then on the middle spectrum, you had African immigrant Blacks, and then Vietnamese, and towards the lower, you had US born Blacks with a net wealth of 4,000, and Mexican households with 3,500 median net wealth. One of the interesting things that we found from this study is that while Asian Indians were had the highest median net wealth, it wasn't really driven by home ownership, as this next slide shows. They actually, in terms of home ownership, only had 38%. So it really shows that their wealth was really influenced by income, stock ownership, and savings. So not all high wealth racial groups were homeowners. So we often think that homeownership is one of the main assets to building wealth, but it's not the only. And I guess that's the point there. What we found here on this slide is when we looked at differences by immigrant status, a more nuanced picture emerges. Again, when we looked at the median net wealth of African immigrants, 72,000. For US born Blacks, it was 4,000. When we looked at US born Mexicans, the median net wealth was 58,000 compared with immigrant Mexican families at 3,000. And so, this goes to show that there's, major within group differences as well by immigration and ethnicity. And so there's just a lot of nuance when we think about this work and what does it really mean to close racial wealth gaps. We found that the typical US born Black or Mexican family had 1 cent for every dollar of wealth held by the average white family. For Vietnamese, it was 17 cents for every dollar of wealth owned by a comparable white family. And so what we learned is that a lot of Black, Mexican, Vietnamese families lack the liquid assets such as savings, money market funds, certificate deposits that could be quickly converted into cash in times of reduced income or increased cost of living. Another layer on top of that, immigrants from Mexico and Vietnam were not able to save or build assets because they're sending remittances back to their motherland. And for Black, Mexican, and other Latino groups, we found that check cashing and payday lending is another layer that strips wealth and prevents them from building assets. So we've had a lot of discussion about what women earn compared to men. Veronica showed the information earlier that white women earn an average of 79 cents for every dollar earned by men. And they only own, but when you look at wealth, they own a stunning 32 cents for every dollar of wealth owned by their male counterparts. And this gender wealth gap is especially acute for Black and Latina women who own pennies on the dollar compared to both white men and white women. And we'll only probably see the gender wealth gap worsen as the economy continues to be hit hard. But it's these moments of crisis that prevent an opportunity for social, health, and financial racial justice advocates to collaborate more and work collectively to bring about real change. So now that you have an understanding of the racial wealth gap in LA, let's take a deeper look at some historical key moments that contributed to wealth stripping in South LA. This slide right here shows how the Federal Housing Administration redlined South LA. And redlining along with restrictive covenants, because of these practices, there were very few places where Blacks could live. And one of the only areas not covered in these restrictive covenants extended from south of downtown LA along Central Avenue all the way to Slauson. So as historian Steve Izzodari states, by 1940, approximately 70% of the Black population of LA was confined to Central Avenue corridor and relied upon the avenue to meet all of its social needs. In the 1960s, what we also start to see is the federal subsidies for urban sprawl that led to disinvestment in the central city and increased the development of suburban areas. This led to white flight, in which many of the wealthy and white abandoned the central city for the suburbs, leading to a major reduction in the tax base, as employment and commercial growth would also follow and create a spatial mismatch for poor residents of central cities, as Manuel Pastor, professor at USC, has cited. From 1950 to 1960, we also see that the Black community's relationship with the LAPD starts to deteriorate. There was a notorious chief, William Parker, from 1950 to 1966, who promoted racial profiling and aggressive policing and harassed businesses and patrons along Central Avenue so frequently that his policing methods led to not only breaking up Central Avenue's vibrancy, but also led to the 1965 Watts riots. Another blow to South LA was when the California State Highways Commission campaigned to build the I-10 freeway through the heart of South Central LA. The path for Interstate 10 was especially troubling because it cut through a 500-foot wide section of West Adams known as Sugar Hill. Sugar Hill was considered one of the most beautifully well-kept neighborhoods of African Americans anywhere in America. Ultimately, Interstate 10 was built through several Black neighborhoods, destroying hundreds of homes. And in the 1980s, we see the wave of plant closures led to major Black unemployment and poverty rates throughout the decade. The deindustrialization, deregulation, and global economic restructuring of the economy, led to major disinvestment in South LA. These conditions contributed to the rise of the crack cocaine economy. During the first year in office, President Reagan cut the budget for public housing subsidies and Section 8 in half. And so by the end of his term, federal aid to city budgets was reduced from 22% to 6%, representing a major shift from the pro-urban and public investments made by previous presidential administrations. So the growing economic disparity in South LA caused by corporate restructuring and government deregulation produced this widespread feeling of frustration and powerlessness and because poverty still remained, what we see in the early 1990s is along with the King beating verdicts and police force abuse that was similar to 1965, sparked and set off a cumulative resentment in a violent expression of collective public protest. The difference between the 1992 King riots and the 1965 Watts civil unrest was that there was a multi-ethnic involvement of Koreans and Latinos, demonstrating that tensions were not limited to segregated Black neighborhoods. So in the aftermath of 1992 uprising, Organizations such as community health councils were created to address racial disparities and collectively build equitable systems. And so as we imagine now in this day and age, we imagine equitable systems for LA, California, and beyond. We must remember that inequitable systems are ineffective systems. And we need to use the present moment as an opportunity to reset and think differently for how we serve disadvantaged communities. And so I thought that I would just share a short clip from the PBS KCET series City Rising to provide some inspiration for thinking about, how do we go from here? So let me cue up that video.
Every neighborhood has to have a different solution. There's not one template that fits all. It needs education, it needs housing, employment, it needs healthcare, and it needs wealth accumulation opportunities.
Well, this is your unit right up here in the kids.
You remember? You remember your room was right there? You want to go up there? I remember when she couldn't even walk up these stairs. Remember, Tony?
You remember where she lived, though.
Yeah, I want to see where she got live. Yeah, we live here. No, Whitney don't live down there no more. Yeah, everybody moved. Yeah, everybody moved.
B204. This was my place right here. And I miss it.
You miss it?
A lot. I was on the street for about a year. Always trying to find the right spot to be. This guy that worked at the filling station late night to the next morning, he used to always put a sign on the bathroom door, and he would let me sleep in there and tell people it was out of order. I got blessed. I ended up going to the shelter because I got tired of being all in the sun. And then from there, I got my Section 8 voucher to be able to move into Roland Curtis.
Roland Curtis is 48 units of subsidized housing, 90% Black folks. Most of the average family had been living in the building for about 10 years.
My old apartment, I was here for 7 to 8 years. A lot of positive memories, a lot of positive changes.
It was a good neighborhood, you know. Bad part came with when it was time to move.
There was the billionaire who had bought the property and then dropped 90-day notices to evict everyone from the building.
He had purchased the property clearly with the intention of converting the property to market.
Everybody started panicking, especially the ones that had been there so many years. They figured they would be there the rest of their life.
I was losing it for real. I didn't know what I was going to do. I did not know what I was going to do, where I was going to go, where I was going to stay.
That's when we had stepped in to buy the building. Trust South LA is a community land trust. We are basically a community land bank. We actually come out of a model from the civil rights movement. A group of Black farmers in '69, they were sharecroppers, and were able to get the government to set aside about 20,000 acres of land. They produced their own goods. They were able to create a level of industry for themselves and stability for those families during the civil rights movement.
The land trust is structured to remove land from the speculative market. The land itself is controlled by the community, returning land to being a common good.
When you do a land trust, you're saying that the land is not going to allow its value to go up and down. based on what's happening in the market. When you build affordable housing, you're saying that that housing's value, its rental, is going to be locked in so that low-income people can continue to afford it.
We knew going in to the acquisition that we had to redevelop the property at higher density in order to actually pay for it. So we took residents from the building, from the neighborhood and other community stakeholders to produce site plans.
The community vision that was created was 3 levels. It's going to be 138 units of all affordable housing. It will have commercial space on the ground floor. There will be a full-service clinic by St. John's. The vision for the new project was all created by the residents themselves and folks who live around Roland Curtis. We believe that this is a model that could be replicated around the country to get in front of these generational issues that continue to impact and destabilize our communities.
The biggest question we face is whether or not we're really going to have the courage to recognize housing as a human right and to take it out of a market and understand the importance of home and not just house as something that you sell and exchange.
I don't want to keep going from apartment to apartment to apartment, and then I definitely don't want to be living in a worse neighborhood. A nice 2-bedroom house with a front and backyard, you know, in a good area. That's all I want. Anything else, I can make it happen after that.
We really have to challenge the systems that have created this environment to begin with. And, you know, in order to really challenge all of those systems, like, we need to challenge the way we've been ingrained to think about our relationship to land and housing and to money, to the economy. And those are some things that we can start doing today.
How do you effectively change policies? How do you get to the root of it? We need stability. If we can keep people in place, we can start to increase voter turnout.
Okay, if you haven't checked out the City Rising PBS series, it's incredible. Definitely recommend you all check it out. It's available for free online. But with this in mind, I now wanted to turn to taking a look at the preliminary findings from the study of price of motherhood in South LA study. Okay, so let's do that. Okay, so I joined today with my co-presenter, Pamela Stevens, an amazing and rising scholar getting her PhD in the UCLA Urban Planning Program. I'm going to first go over a couple of the, the methodology that for the study. When we talk about the South LA, these are the boundaries that we used. The area includes zip codes that are at least partially in a 1-mile buffer outside the South LA boundary. And we used, as Michelle mentioned, there were over 100 people who responded to the survey, but there were things that we had to take into consideration when we reported out the results. And so to verify the responses, we made sure that mothers were self-identifying as Black or Latinx, that they were living in or near South LA, as shown on the map, that they completed at least half of the survey to get, the income and debt information that's really critical to understanding, and that there were unique responses verified when the IP address was a duplicate. And so here is just a quick summary of the respondents in the study. We had a total of 81 responses that were reliable. The median year that respondents have lived in the neighborhood is 10 years, but ranged anywhere from 1 to 49 years. In terms of racial and ethnic breakdown, 33% of respondents were Black, and 68% were Latinx, or 67% were Latinx. And then when we looked at household composition, 91% of the households had children living within the household, and then 14% were multi-generational, which means they had parents or other relatives living in the household. On average, the median age is 35, with the ages ranging between 16 and 71. In terms of citizenship, it was primarily US born, with 38% being immigrant, 22% of the 38 being undocumented. And in terms of educational attainment, we see that 24% had less than a high school education. The majority had a high school diploma, but no bachelor's degree, and 60% had a bachelor's degree or higher. So now I'm going to turn it over to Pamela.
Thank you, and hi everybody. I apologize for jumping in a little bit late. So just to begin, I'll start by describing our approach. So we approach the study by with a set of guiding questions, and I'll use these guiding questions to kind of help us think through the findings and analysis that we're presenting today. So the guiding questions were: what kinds of income and supports do mothers rely on? What contributes to wealth stripping and debt burden for mothers? How does wealth stripping impact quality of life and the sense of mental health and hopefulness for children's futures? And then finally, and more broadly, how does wealth stripping affect mothers in South LA? So next slide. So starting with the first question, what kinds of income and supports do mothers rely on? We found that most, so nearly 2/3, rely on wages and salaries as their primary source of income. Next slide. But we found that 96% rely on at least one government program, which signals that they are generally lower income. And the government programs that they utilize the most are food access programs, which tend to be more accessible than things like cash and housing assistance. Next slide. So knowing that mothers tended to be lower income, we were interested in the ways that they are losing wealth and acquiring debt. And so we looked at this in a few different ways. Next slide. So first, we wanted to consider the regular expenses that mothers have. So for most people, housing costs are their biggest expense. And we found that roughly 3/4 of the mothers surveyed are renters. Next slide. And many of these renters have had issues with housing affordability in the past. So the most common reason that mothers, and particularly renting mothers, moved from their previous residence was raised rents. A fair share moved by choice, but evictions were also prevalent among this group. So the next greatest share of people face no-fault evictions, and those are when a rental unit is removed from the market, either by choice of the landlord or mandate by the city, oftentimes because the building or units are not up to code, and that displaced a significant share of the mothers. Next slide. So then we asked mothers about their experiences with coming up short for the month, so when their expenses were greater than their income. So even before the onset of COVID-19, 85% of mothers found themselves coming up short at some point in the year. 1 in 5 said that they experience these shortages most months or every month. And the median or typical shortage for a month was $443. So it's a significant amount of money. Next slide. So thinking on top of regular monthly expenses, sometimes people are met with unexpected expenses, including things like fines. So the most common fine is parking tickets, the common issues that all of us Angelinos can face, but particularly poignant for those living in denser neighborhoods like those in and around South LA. Late payment penalties, which are essentially a cost of either being in debt or just facing those monthly shortages, or both, was next on the list, followed by traffic tickets. Next slide. So when these fines or unexpected expenses come up, many mothers aren't necessarily financially prepared. So as the slide shows, many mothers, or most mothers, do not have emergency or rainy day funds to cover their expenses. Next slide. So when we asked the mothers what they do when hit with unexpected expenses, many of them reported tapping into different lines of credits, such as bank loans, credit cards, and payday loans. Next slide. So looking a little bit more closely about credit cards and credit card debt, we found that not only do most mothers, so just less than 2/3, have credit cards, but many have unpaid credit card debt. Next slide. And then on top of that, the largest share of mothers, 45%, said that they have even more debt now than they had last year. So that debt is just continuing to build. Next slide. And then as I just noted earlier, we saw that many mothers are turning to bank loans to cover unexpected expenses as well. So we found that just about 3 in 4 mothers have a traditional bank account. But even so, just more than 2 in 5 don't necessarily trust banks to safeguard their money. Next slide. And again, we saw that mothers access alternative forms of credit through things like payday loans and pawn shop loans. And here we show that more than 1 in 4, or a quarter, mothers report using these services. And what was interesting about this group is that oftentimes they had bank access, so they didn't necessarily have access to affordable loans through the bank. Next slide. So that was a lot of information for that section of the findings. So just to quickly sum that up, we found that wealth stripping and debt burden comes from 2 levels. So first, the monthly shortages stemming from regular monthly expenses like housing and other unexpected expenses like fines and fees. And then the next level is the ways that mothers fill this gap between their income and expenses, which tends to be through lines of credit. So the next question we have is about the impacts of wealth stripping on quality of life for South LA mothers. Next slide. And we found that many mothers, 45%, have had to sacrifice to make ends meet for their families. For mothers willing to go into detail about those sacrifices, many reported having to rent rooms to strangers, picking up extra jobs or a night shift, borrowing from friends and family, and sometimes straining those relationships through that process, and reaching out to estranged family members or ex-partners to ask for financial help. Next slide. We then asked mothers how often financial stress impacts their mental health, and found that most are impacted at least some of the time, with significant portions being affected very often or always. So 11% of mothers say that their financial worries constantly affect their mental health. Next slide. So when we asked for more detail about why they responded in that particular way, the most frequent responses were around being worried about their expenses, the potential impacts of the pandemic in particular, like losing their job, the well-being of their children, both in terms of providing financial support as well as their ability to be emotionally present for their children. So like if they had to take on those extra jobs, not being present in the home. They also talked about threats of homelessness and broadly just not seeing an end to their financial struggles. So a sense of hopelessness. Next slide. So we also asked how hopeful mothers are for their children's financial futures. So though many, about 70%, said they were hopeful, it's hard to ignore the other side of the spectrum, the 30% who aren't so sure, aren't feeling hopeful for their children in this way. Next slide. When we asked if the mothers had the resources they need to ensure financial security and success for their children's futures, again, many at least moderately felt that this was the case, but nearly a quarter felt that this was not at all the case. So then we can see why such a large portion in the previous slide may have not have been so hopeful for their children, just lack of resources. Next slide. And so finally, we wanted to know what kinds of financial dreams and goals the mothers had in the case that there was an absence of money issues or debt. So what would their dreams be if they didn't have to worry about finances? And the top responses for mothers were home ownership for them and their children, starting their own businesses, and furthering their educations. And then many also talked about specific careers that they wanted to pursue, paying for their children's educations, buying cars in the case that they didn't have them, and setting their children up financially. Next slide. So ultimately, the dream of home ownership rose to the top of the list for the mothers responding to this survey. Just to think back to that earlier slide about renters, so only 1 in 5 of the mothers we surveyed were homeowners. And when we asked what helped them to achieve homeownership, most indicated that affordable loans and interest rates were most helpful, followed by financial help and support from family and friends, and down payment assistance programs like the one started under the Obama administration. So on kind of the other side of the earlier finding, we see how access to money and non-predatory loans can be instrumental in achieving this dream towards financial security. And with that, I'll turn it to Melany to close out the discussion of the findings.
All right. So we know we've covered a lot of data, and so we wanted to summarize the key takeaways from this preliminary study about the impact that wealth stripping is having on mothers in South LA. And so this leads us to our last question: how does wealth stripping affect mothers? So we find that as you know, I'll probably just read quickly through them. 85% of mothers find themselves short for 1 month, 20% on a regular basis, the median reporting a monthly shortage of 443. 84% of mothers don't have an emergency or rainy day fund. 74% of the mothers rent their home, but 37% moved previously because of raised rents, 13% from no-fault evictions. 77% of mothers have unpaid credit card debt in order to support basic needs. From those who rely on alternative lenders, 45% of mothers were using payday loans or advances, and 68% were using pawn shop loans or auto title loans to cover expenses. And then, but lastly, most mothers, 77%, their mental health was impacted by financial stress at least some of the time. So, where will we go from here? We need to begin investing and developing pathways for building wealth and financial security. So we could do this by providing vulnerable women with protections and economic relief from job loss, raise rents due to the COVID pandemic, such as the rent moratoriums, passing CARES HEROES Act stimulus payments, or universal basic income programs that are currently being piloted in Stockton and Long Beach. Passing legislation for working mothers who need access to emergency paid sick days and paid leave, and offering women with affordable and reliable financial products and services such as microloan lending programs. So with this, you know, I think there's a lot of critical key information that informs us and informs the programs and services and policies that we can work on together for the future. And with that, I guess I will open up the floor for any questions.
Wonderful. Thank you so much, Melany and Pamela. That was an excellent presentation. And I just want to remind folks that, again, these are our kind of preliminary findings. We're continuing to go through this data. We're also going to work a little more closely with some of the mothers that responded so that we get a better idea of their lived experiences as evidenced through the survey. and we will be generating a final report before the end of the year, and we will share that out with everyone. We are running a little bit behind schedule. Our next session will be starting not too, just a few minutes, but we have a couple of questions. So we're going to go ahead and ask one of these. One is how can we transform our system so that renters can earn equity in the buildings they live in? Now, I know none of us are housing professionals on the line, but I don't know if any of our folks, Melany, Pamela, Veronica, Rebecca, does anybody have a
maybe Pam?
Answer to that?
I know, Pam, do you want to take that question?
I don't know.
Well, I guess
what. Go ahead.
I was going to say, we do have some examples. I mean, like, like the land trust is an example, and cooperatives, housing cooperatives are some models that could be explored, where, I guess the model is that you don't necessarily, you do own the land for the time that you're renting or in part of that co-op model, but, at least the land trusts and cooperative models will stay within the community, so that it ensures that housing stability remains with low-income, affordable communities of color, to provide affordable housing for low-income communities of color. Sorry, I'm a little bit twisted right now.
Yeah, although as Tomas put in the chat, there are now some models that are being tested and around this idea of equity. And equity is a sort of a standard word in the for-profit sector. And it's something that, if you get into equity, you have privilege. You get in at the front end of something. We don't normally get equity. Equity to us doesn't necessarily mean access, and it doesn't mean ownership. So because there are models that are being tested, part of what I would put out to the group is actually one of the things that is coming out of this work from CHC and Melany and Pamela. It's really about the work that we're trying to understand. And so what is the collective piece that we have here is that this works, like I said from the beginning, this is the very beginning of it, right, for us. And so we are now in conversation and at tables with different people around the country who are doing different types of work and who are experimenting. And we need to call it an experiment. But at some point, we know that there's some basic possibilities here. There are models for it. We just need to also understand that there are models in the for-profit sector as much as there could be models in the for-profit sector. So I think this is actually one of those opportunities. If people out there on the line are interested in working in this particular topic, this is a call to action. To us, our summit this year is a call to action. Part of what we've been looking at is, there's a certain period of time, like we are in a moment of time when there's some opportunities at the table for us to jump in, organize, work at the highest levels of government. Even yesterday, when Newsom announced that he's now going to form a committee to evaluate reparations in California. First governor to announce that he's going to do this. This is an opportunity. So it is about us. The reason we're sharing so much knowledge and so much data is because it is about understanding that data and utilizing it for the purposes of good. And so here's the call to action. We'll do a follow-up. There'll be more webinars, but there'll also be a lot of opportunities for us to collaborate. So I would just close with that.
Thank you so much, Veronica. There are some excellent questions in the chat, and I like the conversation. I think people are responding back and forth to each other. I just want to remind people that last year we launched our Coalition on Economic Resiliency to continue to have these types of conversations. That's what catalyzed the study. That has been catalyzing much of the work that we did to support Prop 16 getting onto the ballot. So we really like to think of this effort and our Social Change Institute as an action tank. We're looking for thought partners, but we're also looking for people who want to work with us to advance strategies that they think might be real solutions. And in light of, you know, our current climate and the situations we are in, this is a call to action. You know, this is a sense of urgency. You know, the statistics, again, that you just seen are really real. I know, you know, I often tie in the personal with the professional, because I think it's important for us to make a point that we're coming from a place as researchers that we have lived experience as well, which is why we're doing this research, right? And so when you're looking at this data, you know, today I can say, hey, I just finished earning my PhD and I'm happy about that, but that's not where I started. You know, I can remember being pulled over and breaking into tears when I got my 4th ticket in a month, you know, for driving, and knowing I couldn't afford it because it was literally like 3 moving violations. That was the day I decided I would never drive a car again without tinted windows. And the minute I got tinted windows, guess who didn't get pulled over anymore? So when you look at how systemic racism adds to the wealth stripping, it's not just about traffic tickets, it's about how all of these systems are working together to literally strip us of our wealth, right? So like at every juncture, you know, and then I go home and my teenage son has gotten a ticket for, you know, walking across the street in the wrong place at the wrong time. And, you know, so, and it sort of adds up. You know, a lot of the women that we talked to, you know, talked about that, you know, as mothers, you're the one in the family, oftentimes as matriarchs, if you are employed, you know, you're taking care of your immediate family, you're taking care of your extended family, and then the statistics on the housing and the evictions are startling. Like, I mean, those are startling, especially when we just had an article out just this last week about one of the most popular startups is an organization that's helping companies to expedite evictions, and business is booming. Business is booming, people, right? So this is a call to action. And with that, I want to make sure as we go into, you know, switching off and we're about to change this, I want to call out again our Slate for Justice, which is, you know, one of our platforms that we have online right now to get everybody and, you know, to get on the bandwagon of making sure that everybody is, you know, doing their part. So this is our Community Health Council's site. So you can pretty much join us at chc-inc.org/slate4justice. So you'll see here, we've got links for voter registration, vote by mail, in person, all of that good stuff. And then we're giving you some of our, and if you're interested in adding your logo, just let us know. We're just starting to collect all of our partner logos, so that list will grow. And so we give you recommendations here for what propositions to vote yes on. And we do plan on hosting a panel a couple of weeks out from November 3rd so that we can dig into these a little bit deeper so that we're informing our residents and everyone else about how to vote and why to advance justice at this time. So, you know, again, I just want to thank all of our esteemed speakers and women and researchers for this phenomenal presentation and insight into the lives of our Black and Brown mothers who are daily struggling to make ends meet as they're taking care of their families and maneuvering what has become an intensely toxic political landscape over the course of the last 4 years, if not centuries. So with that, we'll close this out. I hope that you guys will stay on the line. We're going to actually be moving into our next panel, which is about advancing strategies for resilience. So we've talked, you know, as usual, as much as I hate spending time on, you know, negative conversations, and, you know, Coffee's in my ear right now. She's like, can't we be a little more positive? Isn't there something we can do, Michelle, to make this better for everybody? And I say the answer is yes. Yes, Coffee. There is something that we can do to make this better for everybody. And so with that, we have actually 2 new speakers that are going to be joining us on the line. We have Dr. Marla Parker from Cal State LA, who's done tremendous work in advancing entrepreneurship for women of color on the campus at Cal State LA and beyond. We also have Dr. Ann Price, who is a founder or an executive director of Emerald Cities, and she'll be joining us as well to talk about economic resiliency. So with that, I'm actually looking, I don't know if those folks have joined us on just yet.
Dr. Parker is with us?
I'm here.
Awesome. All right. Hello, Dr. Parker. How are you today?
I am good. How's everyone doing?
Excellent, excellent.
Good.
We've had some pretty fabulous presentations and conversations to date. Now we're ready to really get into the area of solutions. We know what the problems are, and we really want to start talking more about how are we working to advance some changes. And I know that you have done a tremendous amount of work in the area of innovation and supporting women of color and entrepreneurship. And so we'd love to hear a little bit from you today about your thoughts in advancing those strategies.
Yes, absolutely. Should I go first now or?
Yes, please.
Okay, cool. Okay, great. So I'm sorry. I'm coming off of like 2 meetings back to back, so I'm just kind of getting my sea legs going, but I am ready to talk. So my name is Marla Parker. I'm an assistant professor at CSU LA. And I'm also co-founder of the Civic and Social Innovation Group. And so what basically we're about is it's a loose, informal group of faculty, staff, and students who promote entrepreneurship and innovation as a way forward for positive social change. And so our whole thing was, how can we get students, especially in the social science area, to use entrepreneurship and innovation in a more intentional way? Because typically, you know, like when you think entrepreneurship, you think, okay, this is money making, this should be in the B school, or, you know, it has to do with economics. But we really believe, right, that there's more to profit, right, than just money, right? There's a such thing as like social profit, right? And so what we want to do is that what we have been doing since 2017 is taking that kind of impetus and that value set and, you know, saying, all right, what can we do here? And so I've been working with my colleague, Dimitri Seals, who's a lecturer in sociology, for like, how do we do this and what should we do? So I do have a few slides. Would you mind if I shared those, Michelle and Veronica?
Yeah,
okay, cool.
Should be already the co-host, so you should be able to do that.
Okay, awesome. Hopefully, yeah. Okay, can y'all see this? It says nurturing ideation and entrepreneurial self-efficacy. Okay, cool. So basically what we started with in 2017 was just, you know, how do we get students excited about innovation and entrepreneurship, especially in kind of these non-traditional ways, right? Because we were teachers, you know, and we still are teachers in political science and sociology classes. And so that's not necessarily a natural thing that you think about bringing political science, sociology, and entrepreneurship and innovation all together. And so for us, the challenge was, our biggest challenge was actually getting students to believe that they could do this, getting students to believe that they could be entrepreneurial and innovative in this space, right? And so a lot of what our initial work was focusing on getting them to really open up with their creativity, but then also getting them to understand that you have wonderful ideas, right? And you have so much to offer, and you have so much just creativity, you have so much knowledge. And so let's not be afraid, right, to take these steps and to learn something new. Because one of the things that we found when we initially started was that students didn't see themselves as entrepreneurs. They didn't necessarily see themselves as innovators. And again, they couldn't quite make this connection between making positive social change and these entrepreneurial, innovative principles. And so we just took a risk, right? Dimitri and I said, look, you know, we are going to start where we're at. We're going to start in the classroom because this is where we have our, you know, locus of control, right? And so for us, you know, him being a lecturer, me being, you know, tenured track faculty, not even having tenure, you know, like us taking that risk was a pretty big deal. So what we did is that we infused these principles into the classroom so that students were getting them basically for an entire full semester. So I restructured my courses so that I eliminated exams. I'm like, you know, you're not going to do exams anymore in my class. You're going to basically just focus on problem solving based education, right? And so like I created this assignment where they had to kind of be, you know, little startups, right? Little startups. And they had to use these principles to address an issue that they wanted to address. So I didn't even force an idea on them. They had to collectively decide upon an issue to address, right? And so their solutions range from everything from starting a nonprofit to, you know, like creating a certain kind of technology, right? You know, creating a certain kind of a service, creating an app, you know, things like that. And so that was kind of like our first step in doing all of this. And so like I have here these lessons learned that, you know, hopefully will be of interest to you. And so like when you're doing this kind of work, when you're trying to like really motivate change and you're trying to really just, and it's not even inspire, it's not just inspiring, right? It's again, creating that entrepreneurial self-efficacy, because self-efficacy is super, super important. It is absolutely critical for the success and the resiliency and just the, in the grit that's necessary, right, to get into this space. And so, you know, like one of the things, here are a few things that I've learned, right? So lessons learned and recommendations for how do I inspire and how do I facilitate and nurture self-efficacy among BIPOC students, right? So one thing, right, identify how you can create change that's in an area of your locus of control. So for Demetria and I, that was our classroom. That's where we had the most control over, right? We didn't necessarily start, you know, like at the university level with programming. We started in the classroom and then we branched out. Number two, don't do the work by yourself. I could not get far at all if I did not have Demetria as a co-founder. So don't shoulder this alone, okay? Be willing to take risk, right? But also build a network of support and allies. That is absolutely critical. And I say this kind of in the same sentence because you will need people who can help kind of buffer you, right, as you're doing the risk taking, okay? And one of the ways I can help you with that is to be a gracious collaborator in several spaces. So what I had to do is, like, when there was something that was going on, I would offer my help. And that was my way of creating social capital, right? And again, creating these networks and alliances as well. Build your network outside your institution. So one of the key things that we've done at CASIC is that we've grown from just kind of focusing internally to now we are partnering with organizations, right, like CHC and a whole bunch of other places, and even me and Dimitri's individual, you know, people who we know in our individual network, and we are bringing these resources into the campus environment. So that people, not only can students experience this and to see, right, like really cool examples of social entrepreneurship and innovation, but also so that people who are in decision-making seats can say, oh, okay, like they're really doing something here, right? Like they know how to, they're bringing resources on the campus. This is a really good thing. The next point is redefine or expand your concept of success. So when I first started, I was like, I'm the kind of person where it's like, I can have a vision and I want the vision to happen yesterday, right? But that's not necessarily practical, okay? So I wanted students to be able to create their ventures, right, immediately. But the more I got into this, I understood we have to kind of start with basics first, where they can actually get to a point they can believe that they can do this, right? And that they are really in a state of an innovative, creative mindset, right? And so like we had to reimagine our success. So rather than immediately success being, okay, they're going to start a venture, success was, you know what, they feel better and they feel more confident about taking this pathway. Now we're at a point like 3 years later where we are, you know, putting back on the table that measure of success of, okay, now we need to start having students actually create something. Now so that measure of success now is back on the table. So the next point, implement strategically so that you can be consistently successful at what you have control over, and invite key decision makers to see what you're doing. So that's why it's important to start with your locus of control, because you have control over it, right? And so if you can be consistently successful in that realm, and you can show decision makers how, like what you're doing, but also how that aligns with things like strategic planning, and that's good. So as Demetria and I were doing this work in the classroom, we would have you know, like the dean and the associate dean and other people, you know, and the provost, right, come to the classroom and say, hey, look at what we're doing. This is how this matches with this whole entire strategic plan and the overall mission of the university, right? Because sometimes when you get into these big organizations, it can be hard for people to see how does what is happening, you know, like in the classroom on the day-to-day level match with like these more grandiose ideas, right, of strategy and planning. I have here go slow to eventually go fast. So that kind of gets to my point above when it talks about like redefining success. So again, we had to kind of slow down and like really focus on, you know, building, I would say, a group of alliances, number one, right, over time. And then also really building a really strong body of students, right? So now at this point, 3 years later, we've had like hundreds of students like go through some kind of form of programming with us, right? So that has then allowed us to build out our programming because we've been able to pick students who are now interns, and that can kind of help us to increase our capacity and increase our scale, right? The last thing is like be ready to pivot. And so, you know, being ready to pivot might mean, all right, we may need to maybe take out one dimension of what we're doing if we're not finding that it has success. Because one thing that can be difficult is like, again, like when you have a vision or a way that you think something should go, you can hold on to it, right? But you have to be able to read the room and understand and recognize like, okay, maybe my vision is not quite aligning or what's ready for what's in front of me. And so you may have to use a different strategy, and that's okay, right? So now what I have here are considerations for, oh, actually, before I dive into that, any questions at all, thoughts, feedback? I've talked a lot.
I think you're doing great, Marla. I think if you just continue on, we'll have a conversation once you're done with your presentation.
Sure. Okay, great. Awesome. Thank you. All right. So now what about, you know, the context of maybe you're not in a university setting, right? And that's okay. So there are ways for possibly implementing something similar even outside of the university setting, right? So number one, all right, start small with a program or even an activity with leaders and students or, you know, young people that you trust and who you know will participate consistently, right? And you can make it short term. Because like sometimes when we want to make these big, massive changes, we automatically go to the change the world realm, right? As opposed to just starting small, right? Small matters. And that was something that I had to really learn and pivot my mindset towards, is that, you know what, even if only one student was transformed by this was successful, right? So start small. Okay. I would say the second thing, especially in this time, this day and age, use technology to scale production and delivery of your content. And so, you know, one of the things that we are always kind of pressed for is time. So when you're creating, you know, like these programs or activities, right, like leverage the use of things like pre-recorded content, because that allows people to go at their own pace as well, right? And it respects people's time boundaries and maybe space and capacity boundaries, right? Because you want to create as fewer barriers to entry for whatever program or idea that you have, right? I would say another thing is integrate with existing academic workforce preparation. And so like Michelle and I were talking about this the other day. And so advocating for education reform, right? So it's not just what happens in the classroom, or it's not just what happens in an individual's program, but now you're getting to like systematic things where it's not, where it's, Michelle, you can talk about this. It's like the master plan for California, right? She brought up an excellent point the other day where we have to change that. We have to reform that so that it can really serve people better, right? Where the requirements in the education plan are more up to date, they're more just, they're more equitable, right? Create partnerships that can support short-term and long-term rewards or incentives for various stakeholders. So for instance, you know, you could create a partnership where if a student, you know, is involved in your kind of ideation program, right, or your innovation program, okay, that means that they can get the scholarship somewhere, right? So if you can kind of create that kind of incentive structure for them to kind of stay in it, right, that would be a good thing. And then, you know, from the university's perspective, this can be used as like a recruitment tool for them as well, okay? The last point, use and support a train the trainer model, where successful students or people, right, who come through your program, they can then take the lead and implement. Because again, you can't do this kind of work by yourself and you want to scale it, right? And so I noticed, like, with students, I can only go so far with students, right? I mean, like I am 40, so I am like the old fuddy-duddy at this point, right? There are things that I just don't know, right, about the generation, right? There are ways in which I can't reach, you know, students that other students can reach other students. And so like you want to really leverage that as much as possible. And this can help you with a scaling as well. Because the other thing too is that sometimes when people see others doing what they want to do, if there's no similarity, base point of similarity, they can still think it's impossible, right? So it's like, I remember, you know, like I was going over an assignment with my student, and I showed her how to rewrite something that she wrote for an assignment. And I took her language and I transformed it into something that was more like academic-y. Okay, that's not a word, but still academic-y, okay? And she was like, oh, like, I really want to write like that. I really wish I could write like that. And I'm like, you shall, and you will, right? And this is how, okay? But so it's always this balance, okay, of being a role model, but also understanding that there can be some that can only go so far depending on who the role model is, right? So when students see other students who are kind of closer in their experience range, achieve, right, and transform, leverage that, right, so that you can reach more people. So those are my points. And thank you so much for listening. Looking forward to questions.
Yeah, I think thank you so much, Dr. Parker. I know one of the things that we talked about in one of our many conversations was about access to capital, right? So, you know, when we're talking about entrepreneurship and convincing people of, you know, their ability to actually, you know, be an entrepreneur. I think one of the things you mentioned was not just about the access to capital, right? And how overwhelming that can seem, right? Because it's like, well, it takes money. Where am I going to find money, you know, to start my own business? And we all know that the statistics show that, you know, typically white men are definitely getting the majority of available capital as it relates to entrepreneurship. I think you also mentioned breaking down the word entrepreneur and getting them in a particular strategy and helping folks to sort of get over the idea that this is an area that they just could never do, right? That, you know, they're gonna, like, oh my gosh, entrepreneur, you know, that's such a big word. It's such a big thing. Can you talk a little bit about that?
Yes, absolutely. So what I do with my students is that, you know, before we really start diving into a lot of things, I do a word study, an etymology on the word entrepreneur. So if you do that, what you will find is that in the original wording, there's nothing in there that talks about money. Nothing. Absolutely nothing. Okay. And when they see that, right, that the wording is really about like taking on a project, right, managing a project or managing some kind of initiative, right, then it's like, oh, okay, so like now I'm not hindered by this kind of mental trap where I have to focus on just making money. Right. And when I also do a word study on the word civic and also innovation. And when you do a word study on the word civic, it comes from this Latin term, right? And I forgot, I think it's called civica. Now in the Greek or Roman days, right, civica was actually a crown, okay, that a citizen was given for saving someone else's life. So now when we talk about civic entrepreneur, then when we put those two words together, okay, we're talking about an initiative, we're talking about a project that can save someone's life, that creates community.
Amazing, amazing.
Yeah.
Big difference in what I think people interpret as entrepreneur today.
Right. Exactly. And the other thing too is that, you know, we live in times where people can lose money as much as they make it, right? And so if you are not kind of rooted in these other kinds of principles, right, such as what does it mean to be a good leader, right? What does it mean to, like manage projects? Like, what does it mean to multitask? What does it mean to communicate? You can lose your money as fast as you make it. Right. And so like these are other skill sets that entrepreneurs must have, right? It's not just about whatever fancy idea you have, right? It's also about just like how you move and how you navigate. It's how you build relationships with people, right? Because your venture is going to fail if nobody wants to work with you.
Absolutely. And so I think that's why the collaboration that you mentioned and the strategic partnerships are so important. And that's what makes this, I think, this two-day summit such an exciting opportunity as we continue to build our partnerships at community health councils and our Social Change Institute to advance more strategies for success and for resilience. As we mentioned earlier, community health councils is steeped in its history of really advancing health access, health equity, as well as looking at the built environment of communities and food access and food equity. And in the last several years, in following in Lark's footsteps and in her legacy, Veronica has expanded that platform to really include this whole conversation idea around community ownership and economic development and entrepreneurialism. And I just love that, Dr. Parker, the idea of civic entrepreneurism. I think that's, we're gonna start using that one, right? Like be a business owner, save a life.
Yes,
right?
Exactly.
Right, that's what we're talking about. That's what we're talking about. And so with that, I really wanna pivot now over to Ann Price, who has just joined us. I want to make a note that Sonia Passy was actually going to be on this panel, and we hope that she's feeling better. She woke up not feeling so great. She has a tremendous body of work that she's been sharing around, the impact of wealth stripping and on survivors and what it means to be a survivor and to deal with all of the issues that we're talking about. So we'll definitely have to have her back at a later time. Ann Price joined us actually in April and gave a phenomenal presentation around the impacts of racism on women and women of color and just on communities of color. And a lot of the statistics that we've been talking about and looking at today are some that she's been working with and pioneering around for quite some time. So with that, Ann, please, we are welcome and appreciate you joining us on such short notice. But with one advantage we have in this COVID era pandemic is I just love the fact that all of you guys are sitting here with me and coffee so easily today. We love having this much company. So that's the one advantage we have, right? So Ann, welcome.
Thank you. Thank you for letting me jump right into this conversation, and I hope I can do it some justice. And I'll start off, and if I'm veering off course, please please feel free to correct me. I think, in the work that I'm doing and focusing on, I've really been interested in the intersection of gender and wealth and race. At the very core, they really define so much about our society. And, I love the work that's being done, and a term that's coined by Janelle Jones at the Groundwork Collaborative called Black Women's Best. And it's an economic principle that basically says that if you can actually center Black women who've been certainly exploited in their labor, have diminished power, are underpaid, then you can actually see that our economy could actually do better, because you're also centering other marginalized identities. Basically, if Black women are doing well, then everyone is doing well. And we've never really been able to really think about this for a number of reasons. Now, the first thing I get when I talk about this is people say, well, what about other communities? And I think that at the core of this, and to remember kind of what drives economic inequality, what drives low wealth, really is anti-Blackness. And anti-Blackness, which is the dehumanization and devaluation of Black people, is not just about identity per se, but it really is about power. And, you know, the fact that anti-Blackness is something that actually drives our economy, and it affects everyone who's ensnared in it, means that this is something broader than just being about Black people. But there's nothing wrong about it being about Black people. And I just want to say that, because I think that's really important. But the crux of this really is that when I've been able to really look at how women are positioned in the labor market, and really looking at how segregated that labor market is, which is not surprising to any of us, it's just so deep-seated that it actually impacts the ability for women to build wealth. You know, people who are primary caretakers, breadwinners, who really this economy was built off of, that we are actually been ignoring to a great extent. And so this kind of economic principle allows us to say that that the anti-Blackness at its core is something that actually can perhaps build greater solidarity, because it can show how we're all affected by it, and that it is a driving force in what we're seeing today in thinking about wealth. And so I'm just going to lay that out as something to throw and put on the table, because the solutions that we have going forward in this post-COVID are going to be so critical that we actually get it right. And, you know, in doing this work for a decade, often the solutions are not exactly right, because they actually leave out so much of what affects people in their lived experience and what affects women very specifically. So I'll stop there.
Oh, sorry. Thank you, Anne. Can you talk a little bit more about the alternate solutions you're speaking to, and you know, if not that, then what?
Look, I want to be clear that, you know, when we think about solutions to wealth, oftentimes I'm often asked about solutions. Sometimes often asked about a solution, or almost like a silver bullet. And the reality is that just does not exist. I think that, you know, right now we're certainly seeing how job loss is going to drive wealth loss. And if we think about, you know, like Black-owned businesses, where 20% of folks hold jobs there. It's not just about, it's about the business owner, it's about the employees, that is about a job loss. And so how will job loss actually start triggering other things, right? People pulling out savings, pulling out 401ks, people are actually either delaying or taking their savings to support other family members. You know, how is this all being played out is something that we're still seeing in real time. And so I'm really concerned that the solutions that we're coming up with now may be too premature without greater thinking, right? That this is showing us the intersections of so many systems and structures right now that one alone is not going to do it, right? So how do we really think about this in really a true intersectional way? I mean, the first thing we got to do is figure out, how are people going to get seed capital? You know, how are people who have lost businesses, how are people who, you know, are concerned about themselves or others in terms of income and work, going to have capital to actually begin to either rebuild or to hold on to what they have? And I think that's a really challenging question for us to ask right now. Where's that capital going to come from? And maybe folks in the participants or the panelists have that answer better than I do.
You bring up a really great point, and I think that's a question I'm going to pose to Dr. Parker, as well as Veronica Flores, our CEO, at this point, to broaden the conversation. And that question is going to be around, you know, as we look at at some of the ways that seed capital could be created just on a basic level, because as many of us know, and thank you, Dr. Parker, for laying out the idea that entrepreneurism isn't just about having access to a ton of capital, right? Sometimes, you know, a few $100s, you can start a business, you know, and I think we had a young woman talking yesterday about trying to convince her mom, like, hey, you're a great cook and you could make, you know, you can make more of that and you can sell it. And her mother being very intimidated by that idea and thinking, oh, no, I could never do that. We also just had our preliminary findings from our Price of Motherhood study that showed that on an average, most mothers, Black and brown mothers in South LA, are short an average of $443 a month to make ends meet, right? So now we're also in an era where we've been hearing a lot about universal basic income. We know we have pilots in Northern California and here in Long Beach. We've got organizations like the Family Independence Initiative that we hosted several weeks ago, who do unconditional cash transfers. Much of those dollars are coming from foundations, a few from municipalities, counties, and cities who've agreed to do that. And now we find ourselves at community health councils advocating with some of our funders around, you know, do we want to give out food boxes, or do we want to give people money so they can go pick out their own food? You know, like, how can we instill more dignity, less paternalism, and get money, you know, into the hands of you know, women of color in particular, so that they can start their businesses, take care of their families, and not worry about having to put themselves into compromising positions, which often they do, as we see, reaching out to ex-partners and others just for a few dollars so that they can take care of their bills. So I'm going to expand that, and I'm actually going to turn to Veronica first to answer that question.
Thank you, Michelle. And great to see you, and thank you, Marla, both of you, fantastic presentations. I mean, you guys are like, wow. So, I mean, I think there are a couple of things. There's a lot at the table right now, and I completely agree. So a few years back, quite a few years back, actually, I was working on a project, and we were trying to figure out what are some of the alternatives for forming the circles of support around women. And we started to look at, and I actually met with the governor of Okinawa in Japan, because they formed, you know, it was their 100-year-old tradition to form the circles of at least 5 people that they would come together from birth, right? They were allocated, and so there were 5 women or 5 men, you know, so it was separated by gender, so they would build those relationships, and they were encouraged to meet, so that they meet regularly. And the whole point was that they looked at their lives as, we don't live single issue lives. We started the conversation today about that. We started some of that yesterday. We don't live single issue lives. And so the whole idea was coming to bringing these groups together that the community would support. So the community would then make sure that those 5 individuals would allow themselves the opportunity to just be creative, be entrepreneur, you know, to really think about their families together, because it was the impact of those 5 women in a group would have an impact not only in their own families, but in the community. And most importantly, it was about sharing resources. And so one of those elements was sharing resources so that we could really look at the financial opportunities that a group of 5 women that has the entire community around them supporting would have, you know, stability for their families. So that is something that we started to look at, and I still feel like there's a lot in that particular model that could work, and it worked for centuries. Now, I met with the governor of Okinawa to talk about this, to find out, like, where are you today? And he kind of smiled and said, I know, Americans like this now. But, you know, we were doing really well until McDonald's came into Okinawa, until capitalism and fast food and all of this stuff started to come in. And so the idea of this, talk about paternalistic, this idea of being able to work in group and build each other up became now a competitive environment, which is what we live today. I'm going to make it. I don't know if you're going to make it. So that idea of community was completely removed. So there's history here globally that we can look at. I'm originally from Chile. You know, when I grew up in Chile, we had socialized medicine, which we don't have anymore. We had opportunities. My father, in fact, because my family's entrepreneurs, you know, entrepreneurship, like Marla said, it's about survival. It's about, you know what, I can do this. And my parents were very much about that. But before that, he worked for a company, actually the government. And so it was specifically around housing, because the idea was, if you own land, if you have equity, go back to that word, if we have equity, right, we live better, we support community, and their government then has less demand. So what they started to do, and they did this continuously, there was a period of time where if you wanted to buy your home, the government gives you half, would, not anymore, would give you half of your down payment. And so community could help you support, come up with the initial, but government would give you at least half of that. So you had the down payment. So it allowed people to really begin to build opportunity and buy their little places, right? And so because home ownership, when I say, does the home ownership mean everything? Maybe not to some people, but when you live in a community that doesn't have power or is considered to not have power, owning your land means everything, because politicians will not even talk to you because you don't produce taxes, right? You don't pay property taxes, so you mean nothing in this environment. So I think understanding the impact of land ownership in communities of color, particularly Black and Brown, it is critical. So I just want to make sure that we understand that piece of it. So I think that, you know, for us, I also come from the finance background. And so I'm thinking, you know, okay, you know, we got to just blow this thing up. And I've been having conversations around equity funds, or, you know, what happens with equity funds? How do we look at equity funds in a way that doesn't strip our communities, but we actually begin to take ownership of some of that? There are elements of equity funds that we should be considering. Hedge funds. Those are hedge funds are betting against us, right? And they're making a lot of money because, hey, we could bet against ourselves and we would be making money. So, you know, so understanding that there are products in the private sector that can really apply to us if we collectively, with people like they're on the line right now, and Marla, you know, coming together, Tracy Gray, you know, that are women that are just powerful. Holly Mitchell, who's involved in this, you know, women that are putting everything they have on the line to look at systems that are already there. And we just need to switch in some way. So that's the collective power of coming together like this as women who are in this space.
Excellent. Thank you, Veronica. Thank you. So Dr. Parker, on the same note, just around that idea of the access to capital, I just want to say, you know, one of the great examples of this, and Veronica just called out her name, Tracy Gray, co-founder of the 22 Fund, and myself and a few other folks went up to Sacramento and met with the Women's Caucus and others around Prop 209 and overturning it, and really excited to see Prop 16 on the ballot, which everybody needs to be, you know, voting in favor of, because what that does, and folks don't realize that Prop 209 was not just about affirmative action in the university or academic systems. It has also limited funds from designating women and people of color to receive capital. It has actually made it illegal. So we have had women of color and other people of color, entrepreneurs, going to places like Texas, where they can designate women and people of color to receive funds. Okay, folks? So it's easier for people of color and women to get seed capital in Texas than it is in California right now because of Proposition 209. So this is one of the reasons, and Coffee agrees, that you should be voting and looking at our Slate for Justice on our website, which will tell you that you need to vote for Prop 16. So, Dr. Parker, on the topic of access to capital, how do you deal with that when you're talking to your students and they do have great ideas and they do need capital? What are some of the recommendations you're giving them?
So I'm a firm believer that certain kinds of other capital can get you to certain kinds of other capital. What I mean by that is, you know, we always think of capital just in terms of money, but if we're taking a cue, right, from our Caucasian brothers and sisters, we know that relationships and social capital leads to money as well, right? And so one of the things that I really encourage my students to do is to do a self-assessment about what are their strengths, right? Like, what are their strengths? And, you know, there are students who are so good at talking. I mean, you know, I've been taking in a little bit too much, right? And I'm their teacher, right? And so I think that students have to be really aware that they have these gifts and talents and other types of capital that can lead them to, right, that can lead them to what they want, to the big capital, right? Now, the other thing though too is starting where you are. Like you said, there are tools out there now and mechanisms and platforms that can really give you a jump start to your entrepreneurial venture, right? And so exploring and really exploiting those tools as much as possible just to get you started, right? You know, I have a student who speaks Spanish and she's always wanted to be a translator, right? And I'm just like, there's demand for this, right? There are plenty of places that you can go to get this done, right? So I think for students, or I would say for those of us who are more experienced, it's really incumbent upon us to help students be a lot more savvy, as savvy as possible, to say, this is how you get your foot in the door. This is how you present yourself, right? A massive part of entrepreneurship is, and this, I mean, I kind of hesitate with this wording because of like the kind of racist constructs it has to it, but how you sell yourself, right? It's how you present yourself, right? Because people are definitely going to be attracted to you, and then also whatever product or service that you have, right? I remember two of my students pitched an idea. It was, I kid you not, it was a 5-minute presentation about an app idea that they had where it pretty much like translates technical policy language into something that's more accessible, so that the everyday average citizen could understand what the heck, you know, a bill is, right? Or whatever policy whatever is coming down the pipeline. And they told me afterwards that, you know, as soon as they were done, this guy came running up after them. And this was like several years ago. This guy came running up after them and he's like, does this app really exist? Because I'm doing a weed startup and I need people, right, to support legislation that's going to support me. So if this thing exists, like, let's work together. Now, I wasn't there at the time because I would have told them how to navigate that whole situation, but they told me the story afterwards, right? So it's like, if you can situate yourselves in those kinds of contexts, right, then that matters, right? I'm working at a wellness tech company right now, and every single time I talk to the CEO and the founder who's out doing investments, every time, right, he comes back with like a fundraising report, people love the idea. They love it. And they are standing by, right? So if you know how to really work the existing capital that you have, right, cultural capital, social capital, that can lead you into pathways to other types of capital, right? Now, on the other side, with people who have the money, you know, and this goes back to risk taking, and I love what Veronica said about, you know, this idea of community and communities coming together. Like, we really have to kind of overcome this kind of toxic individualism that I think that we've all been, you know, imbued with, right, and conditioned to live by. All the things that I talked about with what I was doing at CHC, I had to shell out some of my own money to get it done. Right, I could not wait for the university to give me the blessing. I couldn't wait to go through some kind of like application process. I couldn't wait to go through like the kind of bureaucratic machine. I'm like, I have to get this done. I believe in this. I'm going to use my own money, right? And so when I think about seed funding opportunities, I love the fact that we have organizations, but could we create like our own little micro seed funding communities in our own neighborhoods, right? Because again, let's say that you have someone who wants to do like a t-shirt business, right? You can use Shopify or another platform for maybe like $50 a month to get you started, right? And wouldn't it be cool, you know, if there were people who would be saying, okay, you know, I'll pay your Shopify bill for like the next 2 months, right? And then somebody else can pay it for the next 2 months, right? So it's like this kind of runway approach. And that's why I love like the whole runway concept, because it's super intimidating to try to go after $1 million, right? And you may not need the $1 million right then and there. You just may need like a fraction of that. And so is it possible for us to build these kind of micro runway, you know, like these kind of like the micro runway seed funding, right? To where it's like, look, I have no problem partying with like $200 to help you out to get you started. So like the barriers to entry have to be a lot lower. And I think they have to be even micro localized. Right.
Great point. Thank you so much for that, Dr. Parker. I'm going to return back to Anne and ask her to respond to that idea of access to seed capital and bring us back into that conversation around UBI and reparations and you know, some of the structural barriers we have, because as we know, the way I'm seeing it is I'm going to get my, you know, universal basic income of $1,000, and then I'm going to get in my car and I'm going to get 2 parking tickets. My son's going to get arrested and I'm going to have to bail him out. You know, and there goes my money, right? So we do realize there are competing systems that, you know, when one door opens, they make sure that the rest of them are closed. You know, it's like it's the trick and the trap, right? It's like we're going to help you, but not really, you know? So that's when I think about reparations, and I think about that as actually this much broader conversation. That's not just about money. You know, to me, when I think about reparations, that goes, you know, definitely, in my mind, 100 steps beyond the idea of universal basic income, right? Reparations is where I'm thinking, okay, now maybe I really can get some seed funding and make my ends meet and be able to, you know, get in my car and, you know, not get a ticket, and there's going to be more doors open somehow. Right? I'm not writing the legislation. I know that there's been some legislation written around reparations. But with that, I'm going to come back to Anne.
That was great. Thank you so much, Michelle. I mean, I think, you know, one, you know, there have been some broader conversations around reparations more than just the check. I think that people are thinking about this in various ways that often don't get lifted up. They are thinking about what this means about community. They are thinking about things and other ideas, like what about, like, you know, that this could be held as a land trust and a whole host of mechanisms, right? And I think that we haven't heard enough from folks that have really kind of community-based ideas and thinking about how reparations can be shaped. Certainly, you know, the idea that people can actually have the wealth that they never received. I mean, we know that why we need reparations. Basically, if we, you know, Black folks had gotten their 40 acres, there probably wouldn't be the wealth gap that we see today. It is the only group that was not provided with any seed capital, the only racial group in this country, right? And so, you know, I think there's a lot of conversations that we can play out there. I have been involved a little bit in the UBI space, in the cash space, and I think the way that people are beginning to think about it is much different than how it started. And I got involved because I just didn't want to, I said this whole tech bro conversation about automation is not the conversation, right? This really does stem from a whole racial justice history of why the National Welfare Rights Organization thought about this, right? Why these were particularly women of color who understood our economy and understood what they needed to take care of their family. That's where these things came from the Panthers, right? totally different trajectory. And so I do like the idea of cash for the very reason that people can make the choice themselves and how they want to utilize these funds. And we know from a couple of what we've seen so far, of course, in Stockton, is what are people using it for? Food. I mean, like really basic stuff, right? Food, utilities, debt, bills, But when I look at the Magnolia Mothers Trust, which is a pilot down in Jackson that's giving women $1,000 a month, but these are particularly low-income women make under $12,000 a year, a whole host of things we're starting to see, right? That people were able to say, like, I could take my child to the ocean for the first time, right? That there are all these other kinds of opportunities that can open up. So when I think about this, I think, what about pooling? What about kind of a community way to pool funds to actually be able to seed something, right? And we can think about this in much bigger ways than what's being discussed right now, and it could be actually structured in a way that's different than how it's structured now, to actually have much more of a community focus. I think that's where the power is, and I think that kind of seeding could actually take people somewhere, particularly with the kind of the amounts of money we're talking about. And so I'm really learning from you, Dr. Parker. I think you've really raised some really great points about how to think about this in ways in which the conversations I'm in are like about these very large, it's about really like large amounts of capital, right? And it just gets stuck there. And it's also about the fact that everything here is about generating wealth, right? And what is going to build wealth. And I think even those discussions are very narrow. They're very narrow on the financial. They're not talking about all the aspects that I think people of color bring when they think about wealth. It's not just purely financial. It really is about social capital. It really is about mutual aid. It really is, we just think of these things very differently, and therefore the solutions and discussions, at least that I'm in, seem to be extremely narrowed and predicated on a model that's really built for white people solely, right? And then it's just supposed to be an overlay onto people of color, onto women, and it doesn't quite work. So of course, Veronica, I always learn and love what you're saying about community, and I just think that the solutions are here. I would love to see them in more spaces that I'm in, because I just feel like we're on a loop here that I feel like is not taking us to a place that gets at a broader discussion about wealth and what it means for people. Because it's been far too narrow for far too long.
Can I add one more thing, Michelle, if you don't mind? I think another thing that's super important when we're talking about resources that we don't talk enough about, I think, but is critical to entrepreneurship is the resource of time. And so that can also be a barrier when you're trying to, like when you're a mother and like you want to get into entrepreneurship, and maybe you have, right, at your disposal the money, but you just don't have the time, right? Because like you're trying to work a job, you're trying to take care of your kids, you may have other caregiving responsibilities. And so you have the intelligence, you have the idea, you have the money, but you don't have the time. And so like, I think we really have to think about how can we even build our time banks here? How can we help each other build our time banks, right? Because the more I work, like at this startup and even thinking about CASIC, right? I know that there are so many additional things that I could have done with CASIC if I had more time. Right. And then the other thing too, is just like capacity, right? It's like, we all know that as a small business, you have to wear many hats, but sometimes you can get a little bit dizzy. So like, it's really important, right? I think to not just talk about resources in terms of, hey, here's a check for your seed, right? But can I get someone to do marketing for you? Can I get someone to do operations for you, right? Because those are very important areas of expertise, right, that someone may not necessarily have, but it's absolutely critical And so like if we have to think about this in terms of, in a certain way, efficiency, because like I know that can be like kind of like a dirty word, right? But if I am trying to overcome a learning curve to do like the best marketing, I'm taking away, right, from the other parts of my business that I need to build, right? So is there some kind of other support that I can get where I can have someone come in and take care of these very critical operational parts for me, so that I can do the best, so I can really shine in what I'm really good at with this particular business idea. So I can kind of keep the gears going, right?
Mm.
Like I'm not getting stuck. So I think that's like another thing to think about when we are talking about resources as well. So not just the money, right? But someone just to do stuff for me, right?
Mm-hmm. Can I add something? Do we have time, Michelle?
Yeah.
Okay. So, I mean, as you're talking, Marla, and, you know, one of the things that, that I know, Marla, we had a great conversation recently and just talking about success. So when we think about the space, it's so latent by the idea of success from this white paternalistic perspective. And if we don't make it there, then we're just not a success. So there's no option. We're a failure. So what does that mean in our communities when, you know, the findings of the motherhood study say, if women had the possibility of have those $400 a month to take care of their families, and their hope is higher education, entrepreneurship, home ownership, they're telling us this is where they are, right? They're telling us like something as basic in that, I just want some opportunity. So let's think about success. And I think, you know, one of those other possibilities that we are now working on, we just really are expanding our entire resiliency aspect, economic resiliency aspect at CHC, and really growing that space. So one of the elements is, for example, on legacy businesses. So, you know, we need to look at those legacy businesses because, and we have a team member now that has been doing this for the last 15 years that we're now going to really go deep on. And so legacy, and has been successful at moving legacy businesses. He's on the line, Tomas Duran. And so how do we look at that, right? How do we look at legacy businesses that have been in communities of color? I mean, I know I can tell you that in South LA, I have talked to Black owners who have said, I am dying here. I need, you know, I can't do it anymore, but I don't want to sell it. I don't want to move out of this because I know you know, it's going to go away. It's not going to stay in my community. And so they're holding as much as they possibly can. And others have had to go. A lot of legacy businesses were closed out in South LA. Manufacturing licenses that were there that have been closed. And once you lose it, you lose it. So the innovation that can happen in our communities, given what we already have, is something that we need to look at, right, as an immediate. And when we were talking about building those community, I don't know if we want to call it funding, you know, entities, or how we support each other, and social capital building, and all these other spaces that we need to be in. That is one thing that we can look at immediately. You know, and then, so when I think about, and also the narrative around success and business transition, a few years back, quite a few years back now, after my father passed away, we were very, very close. This is very personal to me, but I couldn't be in this space anymore. I couldn't work in the nonprofit sector. I was like burnt out. I had no energy. So I decided to be creative and be an entrepreneur. So I started a jewelry design business, and it actually became very successful. And so we had a really good pipeline, but I could only do it for 5 years because that's not my space. I needed to be back in here. Social justice is who I am and what feeds me. So I wanted to sell the business. And there was a woman that I knew who I knew could do it, was very, you know, interested. And I knew she didn't have the money to buy my business. But for me, it wasn't about making a ton of money on this business. It was about what I needed at the time. And I knew she needed that at the time. So my partner and I transferred the business to her with all of the sales channels that we had developed. And then with time, you know, when she was doing it, she kicked back something to us. But it was about transitioning because I knew we were committed to building community. But that's one person. You know, we need to change the narrative and encourage other women and other people of color who are successful in the space that we cannot make it alone, right? And there are ways of transitioning businesses, of looking at legacy, and really supporting our folks that have, you know, actually made it in this space.
Thank you for that, Veronica. We're getting close to moving into our Millen-Z panel, which I'm very excited about. We're going to hear, I always say from, you know, my future bosses, because these women are brilliant and they're young and they're powerful and they've got tons more energy than I could ever imagine having at this point in my life. And so I want to make sure we give them adequate time. But in closing, I just want to go ahead and come back around to Anne and Dr. Parker and just see if you have any other sort of words of wisdom and advice that you can give us as we continue, I think, to come into our power. I really feel in the last, you know, few years that as women and women of color, and I'm going to, you know, give a big nod to Michelle Obama here, you know, that we're just on fire. And in everywhere I look, in every place I see, you know, it's just one accomplishment and after another. And I think what's even more important to me is the job that we're doing to support each other, right? In this very hyper-competitive, toxic environment that we have been in for such a long time, we haven't always done a good job of supporting each other. And I'm really, really excited about the fact that we're doing a much better job of that today. So in closing this panel out, and I'll go to you first, Anne, you know, what else can we do to continue to support each other in closing these gaps and advancing social justice for ourselves?
Well, I think that really bringing some of these issues to broader audiences is really important. And I say that now because there's so much interest now. I mean, there's money being poured into different aspects of what people want to do around race and wealth. It's not necessarily extremely well thought out. And actually, you know, over time, my concern is that people can say, well, we've made these investments, we haven't seen the impact, so this isn't something that we can really solve. Because I've certainly heard that before. And now that there's an opportunity and people are thinking about this, my biggest concern is, and even conversations I'm in, are what's being put out there right now, I think, is almost harmful because it is not really, it's not really lifting up lived experiences, ideas, innovation that's happening, and some that's been discussed here today. And I quite frankly, I'd love to see some of these conversations elevated more. I think we need different solutions, honestly. Like I said, I'm in conversations that just are almost, have been the same for nearly a decade, honestly. They haven't shifted dramatically, which is surprising. And so these kinds of studies, like the motherhood study, all these kinds of data and even if this is qualitative and storytelling about experiences, is so important right now to shift our thinking about what's possible. And so anyway, I just want to say thank you to all the panelists and to the participants, because this is actually fantastic. Thank you.
Thank you so much, Anne. Marla?
Yeah, so first of all, thank you so much for the opportunity, and I echo everything that Anne said, and on top of that, I would just say small is big, so start where you are. It can make a huge difference. If all of us are doing what we can in the areas that we lead in, because we're all leaders, that does add up, and we do it consistently. right? We do it consistently. That makes a big difference, and it can add up tremendously. So again, remember, small is big. So start where you are.
Awesome. Thank you so much, Marla, and thank you for joining us today.
Thank
and
you.
Veronica, anything before we take a short break before our next panel?
Yeah, I would, I'm just like, wow, with all of you guys. So I would say, we've said before, this is a call to action. Like, we cannot let this moment pass, what we're talking about today. I'm going to keep saying it. We're doing it. So it's a call to action. We'll follow up. We'll have stuff. So we hope you come in. There's a lot of amazing women doing amazing work, and we're in this space together. We're saying, let's do it. So, and we can do that. And so the last thing with that, I would say then, let's keep the ecosystem as the word of the day. Because if we don't worry, and if we don't understand the ecosystem of our communities, then how do we build social capital? How do we understand what institutions are there for us or are not there for us? If we don't understand the ecosystem, how do we understand the dollars? As Anne said, completely right, I agree with her. What's happening today, it's a setup. And so how do we understand what that means to us? Because it's happened forever. This is not new. Like, we're not very good about history. I swear to God, I should have been a historian, but that wasn't my thing. But we should be looking at history. And we should understand that this has happened multiple times. It's a setup. Be careful. There's glass in front of you. And so I think understanding that means it's not about stepping over the glass. It's about wearing the right shoes and stepping over the glass. And I think that's what we're trying to do today. So I am super thrilled that we've had this 2 days of incredible discussions, and that will continue. But we'll continue with action. So thank you, everyone.
Awesome. Thank you so much, Veronica. Thank you, Anne. Thank you, Marla. You guys have been awesome. And feel free, folks, to go ahead and take a break. We're going to stay logged on. We've got a fantastic, next set of speakers coming up. I think, oh, hold on a minute. Yes, Coffee. Oh, Coffee says that this is a perfect opportunity for us to turn over to Diane, if she's on the line, to talk about the Slate for Justice, in case you haven't heard. Diane?
I was going to say good morning, but we're already past the good morning. So welcome. I know everyone has been with us since a couple hours now. The referral to Slate for Justice is what we launched on Tuesday evening. It's our organization's call to action about the next 33 days. Many of you are aware that obviously we've been living through this backdrop and living through these last weeks, if not days, if not hours, right? And so one of the things that was important for the organization was to move forward in the next 33 days and empower our community further with not just the work that we continue to do, but in the areas of voter engagement and voter education. So Slate for Justice is our voter education effort that launched on Tuesday evening. And the goal is to educate the community about not only all their options to vote this year, not only with ballots starting on the 5th if you're a registered voter, but the opportunity even up into the day of to register to vote at a voting center location and cast your vote. So if you go to, I don't know if you guys want to show the screen again, but it's chc-inc.org/slate4, the number 4, justice. And it shares information and has a toolkit of different items that people can use. What we're also seeking is those like yourselves who are interested in being part of sort of a organized voter coalition, if you will, about our positions and our propositions. We're taking a formal position on 1516J and a handful of others. And we looked at it from a lens of not only what was important for the organization to have a voice on, but really that continues, how do we affect change at the highest levels, whether that is in this case in the state of California, but as we move on to hopefully into January with the new administration. So Proposition 15, 16, I think we've talked a little bit about regarding affirmative action. 17 allows voting rights restoration for those that may be on parole. So we've taken a yes position on that. We've also taken a position on Proposition 18. I think you see that. So there's a trend happening in California that actually started in Washington State. I had the opportunity to serve for the governor, Jay Inslee, who ran for a short period on the presidential side. But Washington State took more of an aggressive approach to voters and their voting act. And so California is moving more and more towards that. And this Proposition 18 is specific to look at where's the highest demographic of new voters coming in California, and it is the 16 to 18-year-olds as we move forward. So 18 follows where the state is headed in terms of voters and voters to come in the coming years, and the largest block that will continue to be not only in California, but for the rest of the country as well. So 18 looks at 17-year-olds and amending the opportunity for them to vote in primaries and special elections, and really furthers what I mentioned, that the state and the trajectory. So when we think about the voting centers, when we think about day of registration and opportunity to vote, 17-year-olds, if Proposition 18 is furthered, it's part of a longer journey that the state is taking when it comes to voter rights. Other propositions that we've taken a position on is 21. Lots of talk about obviously what we've experienced in terms of moratoriums and for rentals, for commercial rentals during COVID. So we took a position of yes on 21. And Measure J, many of you have already heard about Measure J. I'm sure it's a very progressive approach for our county to potentially have the opportunity for no less than 10% of the general fund of LA County Board of Supervisors, who obviously manages the funds for the county as a whole, but no less than 10% would go very specifically into areas of community investment. So Measure J is Reimagine LA, if you're familiar, very much part of United Way and many other coalition groups who have gotten this on the ballot. And Proposition 21 is obviously regarding a no on our area for that proposition. There's a handful, there's 12 propositions in the Measure J. So you think of 13 items on the ballot, as well as obviously all the choices depending on where your local races are, or obviously your state assembly, Senate, federal representation that everyone will begin to receive on the 5th. So we're excited about making sure to share the information with the community through our programs, through allies like yourselves. So please, if there's interest in joining us, we will also be, like Michelle had mentioned, we will be hosting a voter engagement event, whether that's a town hall or some sort of Q&A, and that'll be later in the month of October. So look for that, and hopefully we can invite you and include you. That event is geared for the voter in South LA who may not know their opportunities to vote, may not even know if they are registered. Educate them about the propositions, understand what is a proposition, what does it aim to do, why would it be on the ballot in California, how did California even choose to, continue efforts in a proposition way, what's the difference between legislation. So it's a little bit of a civic education as well as what's on the ballot. So I lead the policy and government affairs for the organization. So if you see Diane, you'll know who the Diane is as it relates right now as we look towards November 3rd. So thank you for the opportunity.
Awesome. Thank you so much, Diane. Appreciate that. And the other little commercial we want to take is for our social media. So I've been seeing Sergio has been putting our hashtag in there, hashtag Women Wealth Equity. I'm going to add hashtag Slate for Justice. Please do post or share this next session that's coming up, our Millen-Z Voices, that we talked about expanding this community, and Anne mentioned, these conversations need to be lifted up and higher. So take a moment right now. We got 3 minutes till our next one. Send a message, put it on your social media right now. Tell people they need to join in and support you know, these young and dynamic women of color who are our future employers. I know for me, it's my, you know, retirement plan. I'm gonna have to work till I die to take care of my children. I've already let Jasmine know, who's gonna be on our next panel. She's at Cedars-Sinai. I have secured my place with her one day. She's promised to hire me when she is when she's running Cedars-Sinai, you know, frankly, in the next, you know, few years. I'm sure it's gonna happen. So I would encourage you all, please do send, you know, a message, hashtag Women Wealth Equity, hashtag Slate for Justice, Twitter, Facebook, TikTok. You can do a dance, you know, bring in your plant. They appreciate it. I mean, I've gotten really close to my plants since the pandemic started. I have to tell you, you know, I've named every single plant. I can't take credit. My partners actually named some of the plants too, but I did name coffee. Coffee is mine. That's why coffee's in here with me. We have a special relationship. So with that, we have 2 minutes left, and I'm gonna take a look here because I can't always see everyone, but Miss Mackenzie Grow, one of my favorite people in the world, a recent graduate of UCLA, Master's in Public Health, and our project administrator for the Social Change Institute, will be moderating this panel. I am excited to lift her up and introduce her for this next segment. Miss Grow.
Thank you so much, Michelle. Can everyone see my presentation on the screen?
Yes.
Awesome, perfect. Okay. Well, hello and welcome to our panel, Millen-Z Voices, Navigating Wealth and Equity as Women of Color. As you just heard, my name is Mackenzie and I'll be hosting the panel today. I'm super excited to be closing out our event with the amazing discussion we're about to have. And again, welcome. So I'm gonna start by posing a poll question to the audience, and then I'm gonna lay out some context for why we're here and the unique relationship between wealth, equity, and the Millennial and Generation Z cohorts. And then we're gonna move right into a discussion with all of my fantastic co-panelists that you see on the screen right now. So I'm gonna pull up that poll really quick. And this may be your first time hearing Millen-Z, but take a stab at it. What would you define Millen-Z as? Once I get a few votes, we'll move right on. Okay, I have a few answers there. So my most, let's share that, I can share it. The most response was for B, those born after 2000. Let's see if you were right. All right, so if you answered A, you'd actually be right. Those born since 1981 are considered millennials. Millennials are defined as being born between 1981 and 1996. And in 2020, they're aged 24 to 39. So the oldest millennial right now is nearly 40 years old. And I don't think everyone realizes that. Those born after 1996, sometimes referred to as post-millennials, which you might see on some of the charts that I have coming up, are considered to be of Generation Z. While no chronological endpoint has been determined as far as I saw in all my research, it looks like that generation will probably end around 2011 or 2012, based on how previous generations have been defined. But as far as some population stats, millennials have officially surpassed baby boomers as the nation's largest living adult population as of last summer. And lastly, as of 2017, 40% of the workforce was comprised of Millen-Zs, 35% millennial and 5% post-millennial or Generation Z. So we are the rising majority in the workforce. So why Millen-Z? Why are we talking about these two generations together? Well, while it may be premature to say with certainty how the views of Generation Z will evolve, research shows that both they and millennials look very similar on key social and political issues. So if we use the 3 indicators on the slide, Millen-Zs hold views that differ significantly from the older generations. Only about 3 in 10 Gen Zers and millennials, 30% and 29% respectively, approve of the way Donald Trump is handling his job, compared with 38% of Gen Xers and 43% of boomers and over half of the silent generation. On a similar note, majorities in Gen Z and the millennial generation say that the government should do more to solve problems, whereas Gen Xers and boomers are more evenly divided on the issue. And when it comes to race, the two younger generations are more likely than older generations to say that Black individuals are treated less fairly than whites in the United States, and they are much more likely to support the recent protesting of NFL players against police brutality compared to their older, the older generations. Lastly, the two younger generations, Millen-Zs, are more accepting of some of the ways in which American society is changing. Majorities of Gen Z and millennials say that increasing racial and ethnic diversity in the US is a good thing, while older generations are less convinced. Further, not surprisingly, millennials and Generation Z are more likely to have positive views of interracial and same-sex marriages than their older counterparts. So some more key characteristics. Based on a 2018 Pew report, Gen Z is not only the most racially and ethnically diverse generation seen yet, as illustrated in the chart on the slide, but they're also on track to be the most educated generation yet. Even though most are still in K through 12, the oldest Gen Zers are enrolling in college at a higher rate than millennials were at the same age. But according to researchers, racial and ethnic diversity isn't all that's driving the attitudes that we saw on the previous slide that differ so much from older generations, because these generational differences remain consistent and significant among non-Hispanic white Millen-Zs as well. So as you see on my bullets, Gen Z Republicans are more likely than older generations of Republicans to say that Black individuals are treated less fairly than white individuals. And further, Gen Z Republicans are more likely than their older counterparts to say that the government should both do more to solve problems, and they're more likely to attribute the warming climate and climate change to human activity versus natural phenomena or something that is just supposed to be happening. So some education characteristics. As I said before, Millen-Zs are the most educated cohorts as compared to older generations. And as the share of young adults with college degrees continues to climb, it is clear that Millen-Zs spend more time and resources navigating higher academia. If we look at this graph, we can see that about 39% of millennials aged 25 to 37 have a bachelor's degree or higher, compared with just 15% of the silent generation, about a quarter of boomers, and 29% of Gen Xers when they were the same age. So lots of involvement in higher ed and pursuing college degrees. So key characteristics, debt and wealth. Unfortunately, in today's context, more education often means more borrowing and more debt. Millennials appear to have accumulated slightly less wealth than older generations had at the same age, and this can partially be attributed to differences in debt by generation according to the research we have right now. Compared with older generations, more millennials have outstanding student debt, and the amount of it that they owe tends to be greater. So the share of young adult households with any student debt doubled from 1998, when Gen Xers were 20 to 35, to 2016, when millennials were of that same age. So millennials of the same age have about double millennials have debt as compared to Gen Xers of the same age, and the median amount of debt was 50% greater. And so as we see the generations are getting more ethnically and racially diverse and more educated, the diversity and as the generations become composed of more people of color, there are specific implications to this, especially as it does pertain to wealth and equity. As older millennials transitioned into adulthood within the unstable economic conditions caused by the Great Recession in 2018, Black young adults during that time were disproportionately impacted by the continued high rates of unemployment, and they had slower job growth post-recession as compared to their other millennial cohorts. Further, data shows that Black millennials have acquired more education debt, and their repayment of that debt is much slower than that of their white and Latinx counterparts. While there are a myriad of explanations for these observations, high-cost loans, discriminatory practices, not only in lending, but in hiring, and unequal wages are among the most significant. So you can see in the table that Black and Latinx millennials are much more likely to take out loans for their education, and they're more likely to borrow more. This is likely due to the racial wealth gap that exists in the United States, which we've been talking about, for the last few days, which requires Black borrowers particularly to need to pay more for college and, of course, borrow more for college. We'll stay right here for a second. So that's my little spiel, just laying the context for what we're about to talk about. And I hope that this helps to situate issues of wealth and equity within the context of the world that Millen-Zs have before us. And I hope you all learned something new. But I'll be sure to share the links to the research that I cited throughout, so you can all take a look at that more deeply if you'd like. And I would like to also now welcome my co-panelists into the discussion. I'm going to let them, I'm sorry at this, I'm just gonna stop sharing. I don't want to go that far. But I'm excited to let them introduce themselves and then answer an icebreaker question or two, and then we can get right into the discussion. And I'd also like to say as a little disclaimer that we're not trying to essentialize the Millen-Z experience or speak for the potentially hundreds of millions that are represented in those two generations. But we do understand that the emerging leaders that are on this panel face unique challenges and circumstances as we grow older and participate more fully in the world. And before I ask my partners to introduce themselves, I would love to give a shout out to one in particular, Ms. Kalila Williams, who, hot off the press, has just been recognized for all of her great work in organizing by People Magazine's Girls Changing the World in 2020. I saw it today and I just lit up. I'm so very proud and excited that Kalila was able to join us today and all that she's put into this work. Not only on this panel, but the organizing that she does on the ground is, super important and super inspiring. So with that, I'd like to have, my co-panelists unmute themselves. And if you could just give everyone your name, your title, your affiliation, and a quick look into the work you do. And if you could answer my icebreaker, what does being a Millen-Z mean to you?
Hi everyone, my name is Jennifer Molina. I am a research associate at Boston Medical Center. I am from San Fernando Valley, but I'm currently working at Boston Medical. Our work, we're just finishing up one of our studies, which focused on working with mothers who had children with special healthcare needs. So a lot of our work, my work was baselining mothers, a lot of which were Black Latinx mothers, who were from low-income communities out in Boston, which a lot of were Dorchester, Mattapan, Roxbury, and Chelsea. And currently we are doing a lot of work with COVID. So we are trying to reach out to all of our pediatric patients and trying to connect them with the resources that they need at this time. And again, I'm super honored to be sharing space with all of you.
Thanks, Jenny.
Hi, everybody. I'm Jasmine Guevara. I am the Associate Program Officer of the Cedars-Sinai Community Benefit Giving Office, which is Cedars-Sinai in and of itself is a nonprofit, and we get to do a really cool job in that our work helps fulfill that nonprofit mission, so we kind of function as the philanthropic arm of the health system. And I am also very, very grateful to be here. Jenny and I went to high school together, so it's kind of funny to be in a very different life moment together still. And I'm very, very grateful also to CHC for creating this space and seeing the value in youth voices that I know Michelle and I have talked about and means so much and gives me so much optimism. And to Mackenzie, who has done so much work wrangling the four of us for the last 2 months.
Thank you, Jasmine.
Hi, my name is Kalila Williams. I'm an activist with Students Deserve and Black Lives Matter Youth Vanguard. And I work to reimagine public safety and stop the over-policing in Black communities, as well as remove police from schools and defund the police in schools and beyond schools.
Thanks, Kalila. And congrats.
Thank you.
It's tough to follow that. I'm Grace Song. I'm a senior policy analyst here at CHC. I work with Diane on our policy analysis and research, as well as our legislative efforts within LA, as well as at the state level and some federal policies as well.
Thank you, Grace. All right, we're gonna get right into it. We're doing kind of like a view podcast format for our discussion. So I'm gonna post a question and hopefully hear from all my panelists, and then we'll move into the next question and continue like that. So the first question that I have for my panelists here: how does your identity influence the way you understand wealth, equity, and their intersections?
I can kick us off with that one. So this is a really fun one, even just for us to talk about as a panel, because we do have very, very different backgrounds and are in very different spaces at the moment. But I am Salvadorian by heritage, but I definitely see myself as this kind of cohort of new American. So they're not very deep roots my family has here, but they're quite strong. We're kind of here for the long haul. So that's had a big influence on how I wrestle with being, you know, a SoCal resident who really by extension identifies with being an American, and then also thinking about how devalued so many of our communities are in the prowess that the United States has historically had. So especially speaking from like the Latinx community, we have played such an enormous part in what leads to wealth creation. We kind of, a lot of the jobs that our moms and dads and aunts and uncles tend to take on, my mom's a nanny, my dad's in manufacturing, kind of lay the groundwork for the real wealth to be created in the United States. So it's not that I've always felt a part of this story of wealth in the US. We're just not the ones who kind of reap the benefits. So that's kind of been, to me, the big defining intersection of we're very much present in this idea of wealth and inequality within the US. We're just not a part of it.
Thanks, Jasmine. Who wants to pick it up from there?
I can share. I really loved Jasmine's like terminology of New American, because I think it really helped me to finally put a name to it of like, why do I feel oddly in between two different worlds? I grew up in a mixed status household, so I had undocumented parents for a bit of time. You know, my entire family was immigrants, and so I'm the first American to them, you know, really so handling the title of Korean American. And I think it ultimately caused a huge rift for me. The idea or the terms of wealth and equity were not a part of our vocabulary because it was not attainable to us. That was so far out there. Let's work on the daily problems we have today: our housing insecurity, our food insecurity, our lack of wages. I often remember hearing, growing up in a pretty predominantly immigrant town in Queens, where we had, you know, Polish immigrants to one side, Armenian immigrants, Puerto Rican immigrants across the street from us. Often, many of those folks talked about how they were the first fired, last hired. They were so dispensable in this society. So again, I think those are words certainly we knew were kind of out in the abyss, but we would never say it because it was never a reality that seemed possible. And so even now, you know, with the fortune and privilege I've had in my walk of life, I think it's still so hard to see myself thinking about those in terms of my own world and my realm of reality.
Thank you, Grace. How about Jenny and Kalila? How did your identity impact the way you understand those things?
Yeah, I mean, me being African American, I've always understood that wealth wasn't meant for African Americans, especially when we talk about socioeconomical status. We know that African Americans were first seen as property dated back to 400, 500 years ago. And ever since then, we've always remained the lowest on the ladder. And so it's always been big for us when we see such an accomplishment from an African American who's the CEO of a business or who's doing so much for their community, because that means a lot. Because we know that that's not typically how things are supposed to be for us. And I see like that's a big deal, because with the new millennium and Gen Z generations, there's new meanings of wealth that have been like coming upon us, and at the same time it kind of holds us down, because it's, a lot of them are seeing like a lot of people actually being able to get out there, but in order to get out there, it's also like struggling to find employment and dealing with education. So yeah.
Yeah, and Kalila, what do you see? Are there any like specific barriers that you see as obstacles to maintaining wealth or accumulating wealth in the Black community?
Yeah, most definitely. It starts off young from education, as far as when we see the school to prison pipeline, where African American students are policed more than their white students or other students around them, and they end up getting criminalized to the point where instead of getting an education, put in prison or kicked out of schools. And just in LA alone, African Americans represent 8% of the population at the Unified School District. However, we're 25% of the citations, arrests, and diversions. So we can see that there's a clear pipeline from us like being in school to prison, because we're getting criminalized more than our population, 5 times more than our population. In which this further prevents us from entering and finding employment within the workforce. And we know that this society really relies around having an education, a good education and degree, for finding a good place in the workforce.
Absolutely, that's real. And considering the school to prison pipeline is, super important when it comes to youth of color in schools that are policed. Thank you, Kalila. Jenny?
Yeah, I think there's a lot to unpack in this question, but I would say, my identity as a daughter of immigrant parents who came from El Salvador, and just having to, understanding wealth and equity, I don't think that was something that, as a child growing up in San Fernando, I don't think that was something that I really understood. I think, just having to navigate, I come from single mother and a grandmother who was also a single mother who didn't know how to read or write. She was only a Spanish speaker. So just having to be that person in my family to fill out forms for lunch tickets, and having to translate in appointments, and having to read prescriptions at age 10 is something that is, definitely influenced by my identity. I would also say, just growing up in an area where this is just something I recently learned in Sun Valley. There was this article saying that the DW plant had a methane leak, and something I really thought of was, what does it mean for Black and Brown communities to be closer to power plants than community gardens and parks and grocery stores? So I think definitely the way I grew up really impacts the way that, I kind of see wealth and equity and wealth accumulation.
Yeah, that's great. Thank you, Jenny. All right, we can move into the second question. What is an asset of your generational perspective?
So I swear we try to say not the internet, but a lot of it does have to do with the internet and being very connected, and how we talked about this a little bit in preparation about how Black Lives Matter beautifully is a global movement. Its roots are here, right here, in Los Angeles, but it is truly a global movement, and that's been an enormous tool that we have had, I think, for most of our lives, right? As this Millen-Z cohort is, we've really known folks across, like from across the globe in nuanced ways. And that really leads to a lot of power for solidarity and for movement building. The flip side of that, right, which is not the question, I'm sorry, Mackenzie, which is not an asset, right, is that the internet's a fire hose. So I think we've also grown up to be very, doubtful is not the word I'm looking for, but there's so much online that you don't know what to trust. So there's that mix, like having so much at your fingertips at any given moment can really lead to really positive things. But that also means that there can be a lot on there that isn't quite as trustworthy. And I think you just kind of become your own fact checker and filterer, and it's pretty overwhelming, and seeing everything that's going on to everybody all the time is definitely fatiguing. So I think, again, on the asset side, I think our generational cohorts have an enormous kind of potential for empathy and for compassion and for really connecting with folks who have lived very differently than they have. But the internet's a behemoth and it's such a big part of our lives, like all of our lives now. So, well, not everyone. Then there's issues of equity there, right? And access. But I think that's been the biggest thing. I spend a lot of time on it. So I think that's probably the biggest thing to me that's definitive of our generational perspective.
Absolutely. Thank you for that, Jasmine. Who else wants to jump in and ask that? Oh, thank you, Grace.
No problem. You know, I think, but I am for sure a like mom's girl. I think in kind of the theme of this summit, I fit really well into it. But first and foremost, I'm a grandma's girl. I think I probably grown up in a 4 generation household for a short period there. And really the culture I was raised in about respecting your elders, always considering the older generations before you, never forgetting that the road and the path that got you here and even parts of what is laid ahead is not by chance, but by the choices that people have made and the sacrifices. And so I really look up to a lot of people, whether it's, you know, familially and very from like intimate relationships of mentors, my first teachers who really did believe in me. So also remember the ones who really didn't as well, because English is my second language. I really struggled to learn English for the first few years of elementary school. But on a national stage, you know, naturally I'm drawn to women of color and women who may have had similar experiences like mine. And so activists like Grace Lee Boggs, for instance, was one of the very few Asian American women that I could really think about in books or in media and say, wow, there's someone out there who actually kind of gets me. We're not 100% the same, but I could finally see someone. But again, it was only that one and very few example too. But luckily, I think what it causes is the sense of courage and fearlessness, even more so than the generations before us, that I really can do it. I really can do even more than that. And I can call out people who are not helping others or causing more harm than others, that other generations may have had different struggles or adversities that they couldn't do.
Absolutely. Thank you, Grace.
To go off of that, I would say definitely an asset of my generational perspective is just having access to the things that I do. So in terms of like being a graduate of like a university, that's something that my family has never had access to. And, you know, something that my grandma would always tell me was that like you're in places that one dreamed of being. And I think that always just gets me so emotional because yeah, like we are, you know, part of like our family's like vision and dreams. And that's like a lot of pressure, but it's so like beautiful. And I would also say with that, I think that also encourages us to like lead and be led. So it's both like looking for help, but also like, you know, having like a hand, like in your, like just behind you and just like guiding other people also.
Yeah,
Thank you,
going
Jenny.
back to like the topics of like ancestors, I definitely would say, especially for work around activism, it's very important to acknowledge your ancestors, the ones that come before us, especially in the African American community. We've seen the work that they've done, but we know that there's so much work left to do, especially because this fight is never over. This fight for racism and for equality, for justice, for change and democracy is never over. And so we know that we have to keep moving. But with our generation, like we've seen that this generation, especially Gen Z, has been so much more politically active, and we're not one of those there's no politics at the dinner table generations. Like we engage in those conversations that people don't want to have because they might be uncomfortable for some people, but we know that these are conversations that need to be had, especially during such a revolutionary time period of 2020, where we have an election year, but we also have a pandemic that's disproportionately affecting Black and Brown communities, as well as the race, as well as the rise in people realizing systematic racism and over policing in Black communities. So yeah, so as far as like my generation, I know for sure like Gen Z is kind of seen as like the saviors, because like yes, we are more active and stay in the streets and we're more like politically aware, but however at the same time, like, you know, there's only so much that a person can do, so that does put a lot of like high pressure barriers, especially for African American women, because in my fight there's a lot of African American women, so it's hard to just like deal with everything, as far as like meeting expectations with the challenges and barriers that are already there.
Absolutely, Kalila. And I feel like I do hear a lot that the younger generations are like the saviors or it's in our hands now. But, you know, I do hear for the burnout, like you're only 16, you're in these streets, like you're on People magazine, you're doing all this great work, but it can't be, it's not sustainable to leave it, you know, just to the people that are affected the most. So, you know, that's real.
Yeah. Yeah, because like especially like with trauma and everything, like it seems like every week now you turn on the news and there's another name on TV. But for a lot of African Americans, we're kind of numb to hearing another name because this is really not nothing new for us. We've seen this before, and like their stories are repetitive situations, and we've been hearing these stories for years. And so like the trauma and anxiety that comes with living as a target in society where we know that we're over policed, and then like there's the issue of police brutality, systematic racism, and then for that savior perspective, like, oh well, they're gonna save us, this is gonna be the generation that makes change and is gonna do so much for us, we're gonna do what we can. But like at the same time, like putting all that pressure is a lot, because especially for a lot of African Americans, we have the trauma and anxiety that we have to live with on our own.
Yeah, thank you, Kalila. All right, we're gonna move on to the third question, and I'll make sure it goes in the chat. Our third question is gonna be, what is your vision for the future, both for young women of color in organizing and professional spaces and for the world beyond?
I really resonated with what Kalila just mentioned about trauma, not just the ones we already have to carry, but the weight of so many more others who are really looking onto us. I think often when I feel frozen by that anxiety, many folks in my life always remind me that perfection is the enemy of progress. And it's really, to me, a reminder of just take that one step forward. Just do the one small thing today. You don't have to change the world every second that you're breathing and living, because ultimately that is a bit of that pressure. I think a lot of folks, what I'm hearing, or at least what I identify with, feeling. And so I really hope that, you know, as I mentioned, like mentors and like leaders I've seen before me, but there was basically only that one person. I could look beyond like my immediate family or my immediate community. Like I would love to see more representation and less tokenization of that one, you know, role model for any woman of color, you know, whatever their identity, their race, their creed they identify with, so that you don't have to be so caught up on this perfection idea. I really think about particularly growing up and starting to be exposed to, especially like my white friends and white affluent friends, and particularly white boys, like they really, I mean, could do anything. They could be doctors, they could be CEOs, they could be business owners, they could be engineers, like you name it, there's probably someone out there who is a leader that they could go find very easily. And I think to me, though I was always given kind of those types of encouragements, it didn't seem possible. It didn't seem almost logical. Similar to kind of the first question about wealth and equity, like those weren't words we ever used because it doesn't make any sense. Like those aren't things we're ever gonna achieve. So why bother kind of dreaming that big? That seems a little too high. And so I would love to see like women here continue to lift up and be examples and really uphold that kind of fearlessness so that, you know, the others after us don't have to be so bogged down, I think, to be the epitome of the next big thing, because there are already so many great examples ahead of them that they can now just progress even further in that mission or that goal.
Absolutely, Grace. And when we talk about tokenization, you know, it's a good time to kind of plug the Slate for Justice, because tokenization is a construction. You know, it's constructed that we see only one or two people that look like us in these, you know, upper echelons or these higher spaces because of things like, you know, affirmative action being banned. That's how we create things like tokenization and having no role models and et cetera. So it's coming up on the ballot this fall in, you know, 30 something days. So let's get affirmative action back in California. Michelle's ready with coffee. Jasmine?
Yeah, I mean, to echo everything that Grace is saying, and even drawing on the answers from the last questions, all of us are standing on the shoulders of giants, like giants, because they were women of color. So you have to be extra gigantic to succeed in these spaces. And I know we all have, you know, notorious examples that we can pull from. And then we also have the millions more within our own families and communities that most of the world will never know, that are the ones, you know, that you cry to when you're frustrated. So there's a lot of people that we owe a lot to. So it's scary to think about, how do you become the next generation, you know, that's gonna uphold, because the work needs to keep going. I'm so sorry. But on all of this note, there's so much more to do. I think what I envision for the future is going beyond kind of diversity panel diversity, which is what my manager and I like to call it, where everybody has the 2 or 3 people that they can send out to the diversity panel and then hide behind for the rest of the year. So we need to do much, much better than diversity panel diversity. And same with tokenization, that all goes hand in hand. We need more than the one Black member of the staff, the one Latinx member of the staff. That's not enough, because if you're making decisions with a majority, that's not going to work. So I really hope that we can keep kind of bringing people into these spaces, and we've seen it over the last year in the resistance against the administration, right? Like, authenticity matters, and we need to make the professional spaces we're in, the organizing spaces we're in, whatever it is, like, open to authenticity. And we need to do away with these old school white-centric ideas of what's professional and what you bring into the workplace and what you bring into your movement space and what we can air on television. We just need to open our minds up to it and realize that power comes from our authenticity, and we just need to demand the platform for it, not change it to buck to their platform. So
yeah. Thank you, Jasmine. And, you know, being in funding spaces, is there anything that you've seen that has like challenged, you know, what we're talking about today, that we can start to disrupt, you know, the barriers?
Yes, there actually are some very, very exciting things happening. Again, giant shoulders that all of this work is happening on top of. But within philanthropy, right, it's a weird space because we are very much a symptom of inequity, but we are kind of treated as a solution to it. And I think we need to do a bit more reckoning with the fact that we are also a symptom of wealth inequality in this country, right? So how can you be the solution and the problem at the same time? I think we need to ask some tougher questions in that space, but looking at how I want to say it's about 8% of philanthropic dollars actually make it out to communities of color. I think most people on this call could agree that that would not be happening if there were more people of color on staff, on boards, especially within philanthropy. So some foundations are now asking, I'm very proud to say for the very first time on our applications, asking about your board demographics and your board makeup and how many women are on there, how many non-binary folks are on there, what is your board completely white? It's something that we should take into account for, and it's a lens that we should use when we're looking at the solutions that you're proposing to be funded. So I am very excited that there is sort of a tide change within the field, but again, we can always do so much more.
Thank you, Jasmine.
Yeah.
Kalila or Jenny, what is your vision for the future?
My vision for the future, definitely being in activism work. I know that there's a lot of females within the work that I do, so I love seeing women in the work that I'm in. So just that continuance of seeing women in activism, and it's inspiring, especially seeing, because me growing up, the only person that I ever saw that looked like me, that was really known out there was when I read a book about Ruby Bridges. Other than that, I had to learn on my own because that's stuff that they're not teaching a lot of the students. And so it's inspiring to work with these Black women who are making a difference, and being on the covers of magazines and billboards, and being known as the most influential people of the in Times Magazine, and there's so much going on that it's so powerful to see. And as stated before by Mackenzie, these generations are the most ethnically and racially diverse. And so when we think about those races that we say when we say ethnically diverse, in this midst of this revolutionary time period, we know that many are calling for the defunding of police, and many are calling for they're calling for the defunding of police and reimagining public safety and over policing of Black communities. And I think that's important to really look at, because we know that Black and brown communities, especially Black communities, are highly targeted by police. And that includes in schools as well. But as I said before, the school to prison pipeline, just the school police in our schools that are supposed to be there for safety. But when there's not an incident on our campuses, which God forbid there be a school shooting, which everybody comes back to, that's why we have police in our schools. But in the meantime, what they're doing is targeting Black students and Muslim students, and putting us in this group of people to be profiled and victimized and criminalized. So I think it's important for me, when I talk about the future, I really want to see continuance of these young women fighting for justice, as well as people really starting to think of other ways of public safety and other ways that we can think of safety for the generations after us, so that they won't have to deal with the trauma and anxiety that many of us deal with in these generations.
Thanks, Kalila. Jenny?
Yeah, so I would say my vision for the future is the healing of childhood trauma and intergenerational cycles. I think also, like Kalila mentioned, so many women in advocacy spaces, community organizing spaces. I think with that comes a lot of making sure that we're protecting each other, so protecting women in these spaces, because some of these spaces can be used as like predatory spaces. And so protecting Black, brown women, queer, trans, disabled people, I think is super important. Holding each other accountable with like toxic masculinity, internalized machismo, and all of that. I think it's a lot of the work that we have to do. I would also say just, making sure we're in this for the right reasons, that we are, again, representing communities, we're representing our families, and, just like who we are doing this work for. And then I have a lot. I would say challenging professionalism is, which I think we are, to do. And then also just hospital executive leadership boards, researchers, providers, and decision makers who are representative of our communities. So, right, if the majority of our hospital is seeing Black, brown, low-income patients, who is our executive leadership board? Who is running the town halls? So yeah, that's a hope that I see in the future, that we will get there.
Thanks, Jenny. And two things that stuck out to me, and I can open this up to the rest of the panel, are, notions of professionalism and accountability. So I feel like we should maybe talk a little bit more about that. Like, how do you think professionalism, especially for young women of color, can function sometimes as a weapon in professional spaces? And also accountability, like what do you find, or what do you identify as effective means of holding people accountable? Because, cancel culture exists, but, it's getting disputed all the time. How effective is it? It may work to push a person out of a particular place or doing harm, but what is to say that person's not going to pick a new space to replicate the same harm again? Like, how can we truly be holding people accountable?
I mean, I think a lot of it is really looking at the roots of how we run, even the notion of like a nonprofit or an organization, or how we approach decision making. I even gave an example right off the top of my head of like a 50% majority. That's only one way to do it, but I think we take it for granted that it's the only way to do it. There's different forms of providing community services. We can all look back to our families. I also come from an immigrant parent background. Things got done in their communities in radically different ways. There are different ways to approach solutions. People have developed for centuries community-centered approaches, because that's just how we used to do things. So I think unpacking, just the way we run organizations is not a given, and the way we approach government is not a given, the way we approach public services, the way we approach, the stratification of wealth, the way we approach decision making. Do we need to have a board? Obviously that's a crazy hypothetical, but just really being critical about why we do things, and that it's not a natural order that's here of the earth. It's all a system that's been created to serve very specific purposes, and then start unpacking it, because it's not written in some grand, manifesto that this is the way things need to be done. And I think that all trickles down to what we see as appropriate, what we see as professional, what we see, again, as the right way to do things. I think we need to be very critical of the history of organizations and just the concept of how we make decisions, and really think about who it's functioning to serve. Even something like the nonprofit industrial complex, right? Like, there is a middle class that is born out of nonprofit administration. Who is the majority in that middle class? So I think we really need to be critical about the way we do things and the way we kind of engineer solutions to problems, because it was in the hands of folks for a very long time in the past, right? When it was maybe not legal for us to be in the workforce. So I think really going back to our history is one of the ways we need to approach ideas of professionalism and kind of a path forward.
Thanks, Jasmine. All right, unless anyone's got anything else to say, we can move on to the fourth question, which is, how does your current work impact the way you think about wealth and equity? So I know we've touched on a lot of things, but pose that.
I forgot to unmute myself quickly enough. This is, I think, my elder millennial showing. But one thing I did want to plug was that the House just passed, this is me being a policy wonk, but the House just passed the Crown Act, which makes it illegal for any employer across the country. If it passes the Senate, everyone pray for it, but make it illegal for any employer to discriminate someone based on their natural hair or their hairstyle. And so I think when we think about professionalism, and I completely agree with what the other panelists have been talking about, upholding constant whiteness of professionalism rather than the reality of the diversity of folks who make up the workforce and predominantly are a minority majority. It's these types of markers I think we're continually seeing in the world happen that gives me hope at the end of the day for the future, that it is continuing. There's still a lot of things out there, but we can still start to make progress towards it. I think in my current work, as I said, I work on advocacy and legislative analysis. And so to me, having been once on the outside, having been that statistic, that data point, I have asthma because I grew up in a low-income neighborhood next to a power plant, next to sewage. And so when I think about, great, I'm just another one in the data, and ultimately that's all that's done is really further harm BIPOC communities, my communities, I think it makes me hyper aware, really hypersensitive to what I do every single day. The things I say when I'm advocating for something, the things I'm analyzing or researching in data, that I ultimately, the privilege I have now to be on the inside to create change, hopefully, it's not causing unintended harm down the road. And I think similar to what we were talking about earlier about this sort of burden that we all feel to be perfect, to make all the changes possible in the world, to not let our ancestors down and not to harm further these institutions by letting things go as is. It is by calling people out, but in a way that is truly equitable, because words are just words without meaning if ultimately the implementation of that or the impact of that really does cause further harm. I think a lot about intent versus impact and questioning others, questioning myself when we say we want racial justice, we want racial equity, and you start to read through some of the guidelines of what a piece of legislation might say or what this organization is putting out for you to join their coalition. Is that truly the right way to do it? Is that truly making sure we're not excluding and further harming our most marginalized or most underinvested communities? So yeah, it's a lot, but I think it's better than saying, let's just do it to check the box. Let's make sure we put out our BLM statement because everyone else says we don't get left behind. Everyone's so concerned about being on the right side of justice, on the right side of history. But at the end of the day, I think, especially having spoken to predominantly white-led organizations during this period in DEI work, diversity, equity, and inclusion work, to me, the discomfort and the question I always put onto them is, are you just doing this because you want to look good? You want to make sure your brand has that nice little infographic on Instagram out there for the likes? Or do you actually believe in what you're trying to say? Do you actually believe in the words of your CEO's press release that you just put out?
Thank you, Grace. Yeah, so anyone else for how your current work impacts the way you think or look at wealth and equity?
So I will speak on this just in terms of my work. I am currently working with patients in Boston. So I would say, a lot of the things that I've been seeing is a lot of food inequality. So that's one of the biggest things where mothers are not having enough food, enough money to buy formula, enough money for their children, having to sacrifice paying certain things so that they could have food on the table. And so I guess, just working with a lot of patients who are having a really, really hard time right now. There's, mothers who don't have internet access. So then remote schooling is not a possibility. And then there's also people who are living in unsafe housing situations. So I spoke with a mother who said that there's roaches in her apartment and she's worried about her child's health, and that, she can't sleep at night because she's thinking about how she's gonna get through this. And so, some of the things that we're able to do is connecting the resources for food. We're helping with, connection for the food pantry and gift cards, but that always feels kind of like a bandage solution, because what happens next month when they need food again? And so, I think that just shows the inequities that a lot of Black and Brown mothers have to go through. And also here in California, how they were trying to pass AB 826 and to give undocumented immigrants extra food access, right? A lot of these people who are working in the field in Central Valley, who are working through wildfires, bad air quality, a pandemic, and don't have enough food, like the basic necessities that you need. So that's currently my work, and it's frustrating at times because it feels like we need more policy changes. It's not, there's bandage solutions can only do so much, but working with these mothers, a lot of them are just so grateful just to even get a call, and like they're so grateful that someone is trying to advocate for them. So yeah, that's how my current work is impacted.
Yeah, thanks, Jenny. And when you say Band-Aid solution, it brings me back to the results we heard earlier on the Price of Motherhood panel, where we learned that in South LA, Black and Brown mothers reported being an average of about $450 short every single month. And what does one gift card in 1 month really do to ameliorate that? And I want to open up to the rest of the panelists. Have you heard of any kind of like long-term, more sustainable interventions or programming that challenges a Band-Aid solution, that is more sustainable and could really have some strong long-term impact?
I mean, I wish we could go this panel without talking about the current administration, but a lot does need to begin at the federal level, and that type of help, right? So, right, philanthropy can only do so much, community groups can only do so much, nonprofits. Not that there isn't a lot to do, but I think it really, like, right, they're $10 problems, like these need to be $10 solutions. Like, we cannot keep throwing pennies at these problems. So I think a lot of mobilizing, I mean, I'm very grateful. I don't know that I've seen, like, I'm very excited about the energy there is around voting for this election, but I do think a lot of it is going to come from the policy side, from what we can get passed, especially again at the federal level, and what's actually going to reach as many households as possible. And I think we need to acknowledge that if you're contributing to this country, you should be eligible for these things. So I think really mobilizing around making sure that the undocumented community is just as much a part of these conversations about assistance, and that we really, because it's for, right, no, it doesn't help anybody to cut out a group that's already incredibly vulnerable in this country from assistance. So I do think we need to look at the policy side a lot more, which is why I'm very grateful that people like Grace exist in the world.
Thank you, Jasmine.
I would definitely say, like, as far as like in the activism work, like things that can start by change is like the passage of Prop 15, which increase money in schools. That would bring a lot of money into schools by taxing large corporations. We see like a lot of these large corporations aren't paying their taxes, and aren't paying their fair share, and then as well as that are contributing to police unions that continue to over police these communities, as well as health and safety. They're not they're over, like, for example, Chevron and El Segundo is over polluting the local neighboring community, and many people don't talk about that. And Chevron isn't paying taxes either, and they're paying for the opposition of Prop 15 because they want to keep lining their pockets, as well as funneling money to Donald Trump and police unions. And these large corporations they need to start being called out, as well as like start with that passage of Prop 15, and make sure that like these large corporations as well stop the money that they're funneling to these organizations that are contributing to policing and harming the communities around them.
Thank you, Kalila. And I know we're almost out of time and we got to wrap up, but I just want to throw one last question out there. What keeps you up at night?
I think for me, I definitely would say like what keeps me up at night is like knowing everything that's going on in society. Like not only like trauma and anxiety, and like with school being online with Zoom and everything, there's like a lot like going on as far as like having to complete like a lot of work because the assignments are just harder being at home. But also it's like being Black, like that target from society in general, especially like knowing that like I literally just seen in the news how there was a woman literally sleeping in her own home who didn't get justice for being shot in her own home. And like all she was doing was sleeping. And it's like there's not, every Black person has tried everything. They've tried to jog down the street, they've tried to go get Skittles from the local store, they've tried to sleep in their own homes and play video games in their home, and it's everything they have been shot for. So I think like that's probably what most keeps me up at night, is like the worry of like it, like what's gonna happen as I go to sleep, or like the future, like when you are asked questions like where do you see yourself in 5 years or a year from now, and it's like there's always that uncertainty, because it's like, will I be here in 5 years or a year? Like we don't know. And so yeah.
Thank you, Kalila.
Yeah, I mean, I think the fact that Kalila feels that there's doubt behind whether or not she'll be around in 5 years would be something that keeps me up at night. The fact that there's been such a targeting of specific communities for no reason. And just the fact that we haven't progressed as much as I think we want to have had, especially in the last 4 years or so, 3 years or so. So I think the fact that sometimes it feels like our country's leadership is moving us a step backwards is really concerning. Climate change is worrisome as well. I think there's, again, a lot of these massive issues that now feel like they're really on the horizon in terms of just geography. But I think just how much work there is to be done is the biggest part.
Thanks, Jasmine.
Yeah, I echo, I think, the crux of what we all talked about throughout this hour together, just a lot of the weight and thoughts, just ideas even, you know, positive to make change, but there's just a lot happening. And I think I know we talked to us a little bit recently with the 4 of us together, but like literally, I think a phone and having like just unlimited access to news and media and information, ultimately you never shut off that side of thinking. And I think just the physicality of that too, just literally can't like fall asleep because I have like 14 different voices in my head right now talking about this, that, questioning this, that, or make sure to remember to do this tomorrow, or you know, what have you.
Thanks, Grace. All right. Well, if Jenny doesn't want to add, do you want to add to the what keeps you up at night?
Yeah, I mean, I would say a lot of what has been said is, you know, definitely a lot of what keeps me up at night. I think a lot of, you know, children and youth in our generation also having to deal with a lot of anxiety and like sleepless nights, which is just super concerning, right? But yeah, I would say, you know, I guess in terms of like, I guess a positive like note or something, like having, you know, some ideas, like sometimes I can't sleep because I'm having so many ideas and they're just like, I'm like, how am I gonna do this? You know, but yeah, I would say those things.
Thank you, Jenny. Well, that concludes our Millen-Z panel, and I want to thank the 4 wonderful women who joined me today and, you know, contributed to this planning process and shared a lot of great ideas, but, you know, also things that are on our minds. So thank you so much, guys.
So,
thank you.
Wow, just bravo. I mean, like, you guys are just amazing. I mean, I don't even know what to say. I'm just, you know, pretty speechless. It was powerful to just sit and listen and just bask in, I think, your strength and your authenticity, and just, you know, not doubting for a second that you guys are just getting started, and just through your sheer, you know, just your existence and your state of being is it. And you're right, you know, you can't you know, don't get burned out, you know, right? Like I feel you, and I'm looking at Kalila and feeling old, because I remember being 16 and just starting in this work during the LA riots, right? And here we are, you know, I'm 44 now, and there's riots in the streets again, and my role has changed a bit. You know, I'm not getting dragged into the back of police vehicles as I was, you know, back then. I'm, you know, doing a role that I hope is meaningful at this point, you know, but we need all of it. You know, we need all of you playing the role that you're playing in every space and in every place. And just through that sheer force, I know that we will get this done. This has been just such a remarkable, you know, day. I took so many notes. I'm like, future conversations. We're going to talk about grant making and board composition. We're going to talk about public safety and decreasing our trauma and anxiety for generations. We're going to talk about protection from predators and toxic masculinity as we're trying to get this work done. We're going to talk about eliminating spaces that allow for harm. We're going to talk about the Crown Act and getting rid of the expectation of whiteness and being presentable in our workplaces, our schools. We're going to talk about how to eliminate, you know, what's keeping us up at night. And most of all, absolutely, Kalila, we will refuse to continue to exist in a society where we can't even keep our children safe or our families safe when they are sleeping in their beds at night. This is not 1865. It is not 1942. It is 2020. And we absolutely don't have to stand for that anymore. So I just want to thank you all so much for sharing in this day with us, for sharing in our day yesterday. And please stay tuned, because this is not over. We are going to continue to fight. We've got the Slate for Justice, and I know a lot of different people have a lot of different activities they're working on. Please stay tuned. We actually have a Youth of Color activist program we're going to be launching in partnership with the California Endowment. I know Kalila is on the top of my list, so I'm going to be reaching out to her to be in that program, because we are going to continue to build our leaders and our activists to get this work done. I would love to see all of you run for office. We all know that's where it's at. There's another AOC on the line right now. I'm looking at her. I'm looking at hers. There's lots of you. So, you know, that's how we get it done. We want to change policy. We got to run for office. So I know that that's something we're possible, you know, that we're completely capable of as well. So again, just thank you all so much. Thank you to all of our partners, especially Jasmine and Cedars-Sinai. We appreciate you. Blue Shield, LA Care Health Plan, all of our partners, Kaiser, the folks that have been, you know, working with us and supporting us, Charles University. We just appreciate all the support, all the love, all the help, and please do reach out to us for more partnerships and more, you know, strategies and solutions. That's what we're here for. You know, CHC and our Social Change Institute. We need your thought partnership, and we need your solutions so that we can work together to advance them. So again, thank you, everybody. Appreciate you. Coffee says, keep hope alive, keep up the fight, and we'll see you next time.
Thank you.
Okay, I'm going to close this down. Thank you, everybody.
Thank you, Rebecca. Thanks, Mackenzie. Thanks, everybody. Tomas, Sergio, everybody working the lines. Albert, you guys are awesome.